Okay, so good day. We are the group 1, and today we're going to be presenting the first drug study. But before we begin, we'll be having a short game. So that short game will be a 4 picks, 1 word. So this is done to test, to know what organisms or things we're gonna be dealing with the topic. You can participate in the chat box. So the first one to guess or type the word will be having points for participation. We'll take note for the names. So let's start. Okay, first guess. Guess it in 5, 4, 3, 2, 1. Answer is bacteria. Okay, second guess. 5, 4, 3, 2, 1. The answer is fungi. Okay, third guess. 5, 4, 3, 2, 1. Okay, that will be virus. Okay, for the fourth guess. 5, 4, 3, 2, 1. Answer is protozoa. And lastly, 5, 4, 3, 2, 1. So the answer is parasite. Okay. So that's the last round for this. So congratulations to the winners who will be taking down notes for the names. So now you may be wondering, what does the pictures of the bacteria, fungi, virus, or protozoa and parasite have to do with the topic? So I have a question. Do those microorganisms have things in common, especially in contributing to diseases and infection of patients? Well, that, of course, lies to the topic of the basic principles of antimicrobial therapy.
So, antimicrobial agents are vital in modern medicine, addressing infections caused by bacteria, fungi, protozoa, and helminths. Understanding these agents is crucial for patient care and public health. This study focuses on antimicrobial principles, emphasizing antibiotics, antifungals, antiprotozoals, and antihelmintics. Infectious diseases are a global concern, driving antimicrobial therapy's importance. Drugs target microorganisms with diverse mechanisms, indications, and limits. A comprehensive understanding of the basic principles of antimicrobial therapy is essential for healthcare professionals to make informed decisions regarding the selection and administration of various antimicrobial agents. This drug study will delve into the mechanisms of actions, um, indications, contraindications, and potential side effects of antibiotics, antifungal agents, antiprotozoal drugs, and antihelmintics, shedding light on their vital role in managing infectious diseases and improving patient outcomes.
So the first drug type is the antibiotics. So medicines known as antibiotics are used to treat the bacterial infections in both humans and animals. They function by eradicating the germs or by making it difficult for the bacteria to proliferate and flourish. So K for bacterial infection, antibiotics categorized by action like cell wall, protein, and nucleic acid inhibition. Selection hinges on understanding bacterial structures and mechanisms. Next slide, please. So today I'm Angeline Quinto, and today I'm going to discuss the first subtype, which is the glycopeptide. So the generic name of this is vancomycin, and the brand name is Viran and Vancomycin. So in dosage, it depending on the patient's age, appropriate dosage may differ for adults and children. Weight as heavier patient may require a higher dose. So the type and the severity of the specific infection being treated can influence the dosage. And the renal kidney function plays a crucial role in vancomycin dosing. Patients with impaired kidney function may require adjusted dosages to potential toxicity. So, in routes of administration for vancomycin can be either intravenously or typically through a vein or orally by mouth, usually in the form of a pill or liquid. So the frequency for adults, the recommended for intravenous vancomycin administration is typically every 8 to 12 hours. For children, it may be administered every 6 hours. The frequency of IV administration depends on the severity of the infection and the patient's individual circumstances. So in oral, when vancomycin is given orally, it is usually administered 4 times a day for 10 days to 14 days in adults. In some cases, it may be divided into 3 to 4 doses daily for 7 to 10 days. The duration and the frequency of oral dosing also depend on the specific infection and patient factors. So, in the classification of the vancomycin, it is classified as the glycopeptide antibiotic. It is primarily used in the treatment of severe bacterial infection, particularly those caused by MRSA. So, in the mechanism of action, inhibition of bacterial RNA and cell wall synthesis, vancomycin disrupts the bacterial cell wall synthesis by binding to the D-alanine and D-alanine portion of cell wall precursor. So this binding prevents the formation of peptidoglycan, a crucial component of the bacterial cell wall. As a result, bacterial cell walls become structurally weak and unable to withstand osmotic pressure, leading to cell lysis. So in alteration of the bacterial membrane permeability, vancomycin also alters bacterial membranes. It interferes with the movement of ions and molecules across the bacterial cell membrane, further disrupting bacterial physiology and function. So in the indication in intravenous use, vancomycin is administered and following indicated for the following condition in both adults and children. So in septicemia, vancomycin is used in treatment of bloodstream infection, infective endocarditis, an infection of the inner lining of the heart chambers and valves, skin and skin structure infection, bone infections such as osteomyelitis, lower respiratory tract infections. Vancomycin is prescribed for lower respiratory tract infection, including the pneumonia. So in oral use, vancomycin can administered to treat the Clostridium difficile associated with diarrhea, enterocolitis caused by Staphylococcus aureus. This includes infection caused by MRSA. So in the contraindication of this drug, vancomycin should not be used in administered with dextrose solution. It is contraindicated in individuals with hypersensitivity to corn or corn products. When vancomycin is administered, some formulation of vancomycin may contain corn-derived ingredients. So patients who have a hypersensitivity or allergy to vancomycin or any its components should not receive this medication. So the adverse effects of this is in central nervous system, chills, depression, dizziness, fatigue, fever, headache, insomnia, and vertigo. In cardiovascular, hypotension, peripheral edema, and vasculitis. So in eyes, ears, nose, and throat, ototoxicity, and gastrointestinal, abdominal pain, constipation, Clostridium difficile associated diarrhea, flatulence, nausea, and vomiting. So in genitourinary, acute kidney injury, interstitial nephritis, and nephrotoxicity, UTI. So in hematologic anemia, eosinophilia, and neutropenia, thrombocytopenia. So in musculoskeletal, back pain, in respiratory dyspnea and wheezing, in skin exfoliative dermatitis, extravasation with pain, tenderness, thrombophlebitis, and tissue necrosis, pruritus rash, Steven-Johnson syndrome, toxic epidermal necrolysis, urticaria. So in other anaphylaxis, drug reaction with eosinophilia and systemic symptoms, drug-induced fever, hypokalemia, injection site inflammation, superinfection. So in the nursing responsibility, we should monitor blood pressure and heart rate during the administration. It is essential to promptly identify cardiovascular effects or adverse effect reaction, lab tests, and hematologic studies, including blood cell counts, are performed to monitor potential blood-related side effects. So in monitor vancomycin blood levels in borderline kidney function, infants, neonates, and patient over 6 years. So assess hearing as drug may cause permanent deafness. Ototoxicity is a known side effect. So nurses assess hearing before, during, and after vancomycin administration, particularly with extended intravenous use. Monitor eye and oral ratio and nephrotoxicity, including oliguria and cloudy urine. So in patient education, next slide. So in patient education, in case of ringing in the ears, contact a doctor right away to prevent permanent hearing damage. Avoid breastfeeding while using this medication. So next slide, please. So the next subtypes, it is called the lipopeptide. The generic name of this is daptomycin, and the brand name cubicin and cubicin RF. So the the route of this is intravenous. The dosage and in adults typically administered at a dosage of 4 to 6 milligrams depending on the severity of the infection. In children, dosage varies with the age and infection type, ranging from the 5 to 10 milligrams. So in frequency, adults usually given once a day for duration of 7 to 14 days depending on the infection. On children, administered once every 24 hours with the duration ranging up to 14 days as determined by the healthcare provider. So in the classification of the daptomycin, it is classified as the cyclic lipopeptide antibiotic. It operates by effectively eliminating bacteria. So in the mechanism of action, daptomycin function by binding to bacterial membranes, which leads to a rapid depolarization of the membrane potential. So this depolarization disrupts crucial processes like protein, DNA, and RNA synthesis, ultimately resulting in the death of bacterial cells. So the indication of this drug is to treat complicated skin and skin structure infection caused by Staphylococcus aureus, including the methicillin-resistant isolates, Streptococcus agalactiae, as these galactic subspecies, Enterococcus fecalis, vancomycin-susceptible isolates only, and Ixomelis as pyogenes. So contraindication of this drug is an individuals who have a hypersensitivity or allergic reaction to daptomycin or any its component. So in the adverse effects of this is in central nervous system, anxiety, asthenia, confusion, dizziness, dyskinesia, fever, headache, insomnia, mental status changes, paresthesia, peripheral neuropathy, rigor. So in cardiovascular, atrial fibrillation, cardiac arrest, chest pain, hypertension, hypotension, peripheral edema, supraventricular tachycardia. So in eyes, ears, nose, and throat, blurred vision, dry mouth, eye irritation, gingival pain, hypothesia of mouth. So in endo, hyperglycemia and hypoglycemia. So in the gastrointestinal, abdominal distension, anorexia, Clostridium difficile associated diarrhea, elevated liver enzymes or serum lactate, dehydrogenase, GI hemorrhage, jaundice, vomiting. So in genito or urinary, acute kidney injury, renal failure, proteinuria, tubulointerstitial nephritis, UTI. So hematologic anemia, decreased platelet count, eosinophilia, prothrombin time, thrombocythemia, thrombocytopenia, and thrombocytosis. So in musculoskeletal arthralgia, back or limb pain, elevated myoglobin level, muscle cramps, myalgia, myopathy, osteomyelitis, and rhabdomyolysis. So in respiratory, cough, eosinophilic pneumonia, pleural effusion, pneumonia, shortness of breath. So in skin, acute generalized exanthematous pustulosis and cellulitis, diaphoresis and eczema, erythema, flushing, pruritus, rash, truncal erythema, urticaria, vesicolobulous rash. So next slide, please. Um, I sorry. So, in nursing responsibility, nursing consideration, use continuously in patients with moderate to severe renal impairment and monitor drug. So, obtain blood samples for culture and sensitivity testing before starting daptomycin. Monitor results of the patient bleeding studies as ordered. Monitor patient closely for diarrhea which may herald the pseudomyogranules colitis. Monitor patient for evidence of superinfection and inform prescriber if present. So assess the patient for muscle pain or weakness, especially of distal limbs. Monitor patient bun and serum creatine and levels in patients. Next slide. Response to drug closely. So expect to discontinue daptomycin therapy immediately if the patient develops signs and symptoms of eosinophilic pneumonia. So monitor patient for severe skin reactions such as dress exhibited. And next is the patient teaching. Inform patient that diarrhea may occur 2 months or more after daptomycin therapy stops. If severe, advise patient to notify prescriber ASAP. So urge the patient to report muscle pain, tenderness, or weakness and other symptoms of myopathy immediately. And next is instruct the patient to notify prescriber immediately if skin reaction occur because drugs may need to be discontinued. Next slide, please. So the next subtypes that I'm going to discuss is the tetracycline, that the generic name of this is doxycycline and the brand name monodox vibramycin. So the dosage of this is 100 to 200 milligrams for adults and 2.2 to 4.4 milligram for children for mouth and for oral by mouth and intravenous. So the routes of administration of vancomycin can be intravenously, typically through a vein, or orally by mouth, usually in the form of a pill or liquid. So the frequency usually every 12 hours for adults and 2 times a day for children. So the classification of the doxycycline belongs to the tetracycline antibiotic drug class. This class of antibiotic is used to treat the bacterial infection. So in doxycycline, works by either killing bacteria or inhibiting their growth. So it's important to note that it is not effective against viral infection like the flu or the common cold. So in the mechanism of the action, doxycycline exerts its action by being bacteriostatic, which means it inhibits the growth of bacteria without necessarily killing them. It does this by binding to a specific part of the bacterial ribosome. This binding prevents the attachment of the transfer RNA to messenger RNA, which is essential step in bacterial protein synthesis. So in simple terms, doxycycline interferes with the bacteria's ability to make proteins which they need to grow and reproduce. So the indication of doxycycline is prescribed to treat specific bacterial infections. So some of its indication include the respiratory tract infection caused by Mycoplasma pneumoniae. So Mycoplasma pneumoniae is a bacterium that can cause respiratory infection like pneumonia. So stichococcosis or onytosis caused by Chlamydophila psittaci. So this is an infection caused by a type of bacteria that can be transmitted from birds to humans. So it often occurs in people who have the contact with infected birds, especially parrots. So in respiratory tract infection caused by certain microorganisms, so doxycycline is used when bacterial testing shows that the specific microorganism causing the infection are susceptible to this antibiotic. So this microorganism may include Haemophilus and influenzae, Klebsiella species, and Streptococcus pneumoniae. So the contraindication are conditions or situation where a medical should not be used in the case of doxycycline. So it should not be used if a person has known hypersensitive or allergic reaction to doxycycline, other tetracycline, or any of the components of the medication. Using the medication in such cases should lead to severe allergic reaction. So in adverse reaction of this in the central nervous system, headache, intracranial hypertension, paresthesia. So in the cardiovascular, pericarditis, phlebitis. So in eyes, ears, nose, and throats, black hairy tongue, glossitis, hoarseness, oral candidiasis, pharyngitis, stomatitis, tooth discoloration, visual disturbances. So in gastrointestinal, anorexia, bulky, loose stools, diarrhea, dysphagia, enterocolitis, and epigastric distress. So esophageal ulceration, esophagitis, hepatotoxicity, and inflammatory lesions in anogenital area, nausea, pancreatitis, sodium membranous of colitis, rectal candidiasis, and vomiting. So in GU, anogenital lesions, dark yellow or brown urine, elevated bile level, vaginal candidiasis, and eh, eosif- eosinophilia, hemolytic anemia, neutropenia, thrombocytopenia, thrombocytopenic purpura. So in skin, dermatitis, erythema, multiforme, and multipopular rashes, exploitative dermatitis, photosensitivity, rash, skin hyperpigmentation, Steven-Johnson syndrome, toxic epidermal necrolysis, urticaria. So now let's move on to the nursing responsibility of the viromycin. So in the intervention and evaluation, monitor daily pattern of bowel activity, stool consistency, and assess skin for rashes. Monitor LOC due to the potential for increased intracranial pressure or ICP. Be alert for superinfection such as fever, vomiting, diarrhea, and genital pruritus, oral mucosal changes, ulceration, pain, erythema. So in patient teaching, sunlight exposure medication can increase skin sensitivity to sunlight. So protect the skin the patient from excessive sunlight, especially during peak hours with sunscreen or protective clothing. So antacids and iron products. Avoid taking the medication with antacids or iron supplements. This can reduce the medication's effectiveness. Follow the health provider's timing recommendation for these substances. So in complete course of therapy, it's crucial to finish the entire prescribed course, prevent antibiotic resistance, and ensure effective treatment. And dental gel application. After applying dental gel, avoid brushing and flossing treated areas for 7 days. Allows the medication in the gel to work effectively. Report severe diarrhea. Severe or persistent diarrhea could be a serious issue. Report it to your healthcare provider for evaluation and potential treatment. GI upset medication may cause nausea and vomiting. If this occurs, you can take it with a small amount of food to reduce GI upset. So next slide, please. Next slide. So the next subtype is the microlide, or the brand name is the erythroscan and erythrocin stearate. So the generic of this is the erythromycin. Dosage for adults oral is dosage range 250 to 500 milligrams. Intravenous dosage range from 500 milligrams to 1 gram. Administered via both oral and intravenous route. So for children, oral dosage 7.5 milligrams and intravenous dosage range 15 to 20 milligrams. So the routes of administration for vancomycin can be either intravenously, typically through a vein, or orally by a mouth, usually in the form of a pill or liquid. So the frequency for both adults and children is every 6 hours. So in the classification of the erythromycin is classified as the macrolide antibiotic. This type of antibiotic is used to treat the infections caused by microorganisms that are susceptible to erythromycin. So erythromycin is effective in treating a range of conditions, including mild to moderate upper and lower respiratory tract infections, listeriosis, diphtheria, pertussis, whooping cough, and many other illnesses. In essence, erythromycin is prescribed to combat bacterial infection caused by various types of bacteria. So in the mechanism of action, erythromycin works by specific mechanism of action. It binds with the ribosomal subunit of the 70S ribosome, which is a component found in many types of aerobic oxygen requiring anaerobic oxygen averse, gram-negative, and gram-positive bacteria. This binding action disrupts the normal process of the RNA-dependent protein synthesis within the bacterial cells. Essentially, it interferes with the bacteria's ability to make proteins, which are essential for the growth and reproduction. As a result, bacterial cells are unable to produce the proteins they need to survive, leading to their death. This mechanism makes erythromycin an effective antibiotic for treating bacterial infection. So the indication is used to prevent and cure infection in many different areas of the body, um, including the respiratory tract, skin, intestinal, pertussis, syphilis, and diphtheria, and acute pelvic inflammatory disease in individuals who have previously experienced an allergic reaction to penicillin or sulfa medication. This medication is also used to prevent repeat attacks of rheumatic fever. So the contraindication is hypersensitivity to erythromycin, concomitant and administration with ergot derivatives, lovastation, pumazide, and um, sivas- simvastatin. So in the adverse effects of this drug is in central nervous system is fatigue, fever, malaise, and weakness, and cardiovascular prolonged QT interval, torsis, depointis, and ventricular arrhythmia. So in eyes, ears, and nose and throat, hearing loss or oral candidiasis, in gastrointestinal, abdominal cramps and pain, Clostridium difficile associated diarrhea, hepatotoxicity, infantile hypertrophic pyloric stenosis, jaundice, and nausea, vomiting. So in GU, interstitial nephritis, vaginal candidiasis. So in musculoskeletal, new or aggravated myasthenia or Graves syndrome. So in skin, erythema and pruritus and rash. So in other, fluid overload from IV infusion, injection site inflammation, and phlebitis. So in the nursing consideration or nursing responsibility in heart rhythm, erythromycin shouldn't be used in patients with heart rhythm issues or taking certain heart medications due to the risk of further heart rhythm disturbances. In elderly monitoring, elderly patients should be closely monitored as they be more sensitive to erythromycin's effects. So in the liver function, erythromycin should be used cautiously in patients with liver problems since the liver processes the medication. So in elderly with kidney and liver issues, with both kidney and liver issues should be extra cautious as they face an increased risk of hearing loss and bleeding. And infants taking erythromycin should be monitored for vomiting, irritability with feeding as it may link to the stomach condition. So in the patient teaching of this drug is symptom reporting. Patients should be promptly report to their healthcare provider if their condition worsens or doesn't improve after a few days of taking this drug. And in oral erythromycin, patient taking the oral form should take it with a full glass of water on an empty stomach to optimize absorption and potentially reduce the gastrointestinal discomfort. So that's all for that assigned to me. So and next reporter will be is Yumol.
Amicin sulfate is a subtype of antibiotics from the brand amicacin. It's an aminoglycoside that creates fissures in the outer membrane of the cell. Its dosage is usually 250 milligrams, but it's also a adjusted dose, which means the dosage may change depending on the patient in a intramuscular or intravenous route. And it is usually administered every 8 to 12 hours. Amicacin sulfate is indicated to treat mild to severe infections triggered by variations of Pseudomonas aeruginosa, which means a bacterial strain that is able to survive in harsh environments. Escherichia coli, Proteus, Klebsiella, Staphylococcus, Providentia, Enterobacter, and Serratia bacteria. It is also effective against uncomplicated urinary tract infections. Amicacin sulfate requires careful consideration when administered to individuals who display hypersensitivity to other medications or aminoglycosides, as well as those with a sensitivity to sulfates. This applies when treating patients with compromised kidney function, low levels of calcium in the blood, neuromuscular conditions, hearing deficiencies, neonates, infants, and the elderly. It can have adverse effects on different parts of the body, such as the CNS or the central nervous system, the EENT or the eyes, ears, nose, and throat, the GU or genitourinary, and our respiratory. For CNS, adverse effects include neuromuscular blockade, which means that the intermittent failure of transmission of one of the two muscle fiber potentials. For EENT, adverse effects include auto, adductus, adductotoxicity, which means inner ear damage. For GU, adverse effects include azotemia, which means elevation or buildup of nitrogenous product. Nephrotoxicity, process that occurs when kidneys are damaged by a drug, chemical, or toxin. Increase in urinary excretion of gas. And lastly, for respiratory adverse effects include apnea. So as future nurses or nurses, the responsibility is to assess the patient's auditory acuity both prior to and following the course of treatment. Monitor the patient's weight gain, re-examine results from renal function assessment, remain vigilant for indications and manifestations of superinfection, advise the patient to promptly communicate any negative responses experienced due to the medication, and caution the patient about potential hazards to the developing fetus if the drug is consumed while pregnant, and emphasize the importance of maintaining sufficient fluid intake. Next slide, please. We also have the responsibility for patient education, which is to instruct the patient to promptly report all adverse reactions, especially changes in urine, weight gain, edema, hearing impairment, fever, diarrhea, and abdominal pain. We also need to warn the patient about risk to fetus if drug is taken during pregnancy, and report possible pregnancy to prescriber immediately.
So the next drug type is the antifungal. So antifungal drugs represent a pharmacologically diverse group of drugs that are crucial components in the modern medical management of mycosis. So in vital against fungi, especially in immunocompromised individuals, agent disrupt fungal structures, azoles, polyenes, and echinocandins are major classes, each with unique actions.
Okay, so for today, I'm going to report for antifungal drugs. So in simple terms, antifungals are medicines that kill or stop the growth of fungi or fungus in plural that causes infections. So examples of these are Tinea capitis, Tinea corporis, Tinea pedis, Tinea barbae, Tinea manoner, and and Tinea ongio. So we have here the first drug, canesten. Its generic name is clotrimazole, and the subtype of this is imidazole derivatives. So dosage, usually a thin layer is applied to the affected area 2 to 3 times a day as directed by a healthcare provider. Next is the route. So it is given topical and vaginal, so applied to the skin. So there are classifications and mechanism of actions of clotrimazole. So when we say classification or mechanism of action, it is the specific biochemical interaction through which a drug substance produces its pharmacological effect. So as you can see here, classification of clotrimazole is classified as an imidazole antifungal agent. It belongs to the azole class of antifungals, which also includes other drugs like micronazole, ketoconazole, and fluconazole. The mechanism of action, so it is very taas siya. So I'm just going to pinpoint. So clotrimazole is an antifungal medication used to treat fungal infections. It falls under the class of drugs called azole antifungals. Its mechanism of actions involves inhibiting the synthesis of ergosterol, an essential component of fungal cell membranes. This disruption weakens the cell membrane's integrity, leading to leakage of cellular contents and ultimately fungal cell death. So canesten is commonly used to treat various fungal infections, including those of the skin, mouth, and vaginal area. Next is the indication. So as you can see here, there are two types. So total preparations and next slide, please. And oral preparation. So in simple terms, indication for the treatment of this fungal infections, so vaginal yeast infections. It can be used to treat vaginal yeast infections or vulvovaginal candidiasis, oral thrush. Canesten can be used to treat oral thrush or oral candidiasis, which is a fungal infection that affects the mouth and throat. Also, skin infections. It's effective in treating fungal infections of the skin, such as athlete's foot or tinea pedis, jack itch or tinea cruris, and ringworm, tinea corporis. Next is the diaper rash. Canesten can also be used for fungal diaper rash caused by Candida species. And the last one is fungal nail infection. So it's sometimes used for fungal infections of the nails or onychomycosis. Can you ibalik sa first okay, thank you. Sa taas ba? So that is all the indications of canesten drug. Next is the contraindications. So contraindicated, when we say contraindications, it means, So when we say contraindication, it is a specific situation in which a drug procedure or surgery should not be used because it may be harmful to the person. So bawal siya. So meaning ng contraindication is bawal yung drug na yon sa tao. Next is contraindications is contraindicated. The canesten drug is contraindicated in patients hypersensitive to drug. So bawal siya sa mga high blood na tao. Then next is contraindicated for ophthalmic use. This is according to the Nursing Drug Handbook 2020. Adverse effects. So when we say adverse effect, it means a harmful or abnormal result. An adverse effect may be caused by administration of a medication or by exposure to a chemical and be indicated by an outward result such as by illness or death. So sa GI, there lower abdominal cramps, nausea, and vomiting with lozenges. Sa GU is mild vaginal burning or irritation, then urinary frequency. Next is the skin erythema, and then blistering, burning, edema, general irritation, peeling and pruritus in skin fissures, stinging, and urticaria. This is according to the Nursing Drug Handbook 2020. Next is the nursing responsibility. So we really need to be responsible in administering drugs kasi according sa 10 rights of medication administration, it is our duty to properly give the medication to our patient. So first, before giving the medication, we have to assess and review the patient's medical history, allergies, and current medications to ensure there are no contraindications or interactions with clotrimazole. And next is assess the patient's symptoms and the site of infection to determine the appropriate of clotrimazole treatment. Patient education. So explain the purpose of clotrimazole, how it works, and the expected outcomes of the treatment. Inform the patient about the potential effects or adverse reactions and what to do if they occur. So importante na pagsabihan natin ang patient natin kung ano yung mga effects and reactions nila if we administer this type of drug. Next is allergy check. So verify whether the patient has any known allergies to clotrimazole or related antifungal medication. So it is very important to know if may allergy ang patient natin para agad nating malaman kung pwede ba siya, pwede bang ibigay yung drug na yun or hindi. Next is medication review. So review the physician's order and medication administration record to ensure the correct dosage route. And next slide, please. And frequency of clotrimazole. Then after giving the medication, correct the dosage. So prepare and administer the correct dosage of clotrimazole as per the physician's order. Dosages may vary based on the formulation and the type and severity of the infection. Next is administration technique. So it is really important to follow proper aseptic techniques pag mag-apply ng clotrimazole cream or ointment to the affected area. If administering clotrimazole drops or lozenges for our oral thrush, instruct the patient to dissolve the drops slowly in the mouth without chewing. Next is patient comfort and safety. So ensure the patient if he or she is comfortable and understand the administration process. So observe the patient for any immediate adverse reactions or discomfort during administration. Next is during. So during, we have to do a documentation. So record the administration of clotrimazole accurately. The patient's medical chart include the date, time, dosage, route, and your initial. So it is very important to document para ma-remember natin yung mga binigay at ginawa natin sa patient natin para if ever gustong malaman ng doktor, we have the so we have may maibibigay tayo sa doktor. Next is patient response. So monitor the patient's response to treatment. Look for improvements in symptoms and signs of healing. So we have to monitor if nag-heal ba yung sugat or yung fungal infection ng patient natin. Next is patient education. So reinforce any additional instructions regarding the continuation of treatment or follow-up appointments. So if ever nalaman na, if ever nakita natin yung improvement, we have to give pala ng additional instruction para if ever kung i-continue pa nila yung treatment. Then adverse reactions. So educate the patient about the possible adverse reactions that may occur after administration, such as irritation or allergic reactions, and instruct them to report any unusual or severe symptoms. So next is patient and family teaching. So reassure patient that hypopigmentation from tinea versicolor will resolve gradually. So this is important para ma-understand. This is important so that the patient will have that understanding if Then warn the patient not to use exclusive wrapping or dressing. So it is very important kasi may instances na may infect yung nilagyang treatment. Then warn patient to avoid contact with eyes. Next is caution patients that frequent or persistent yeast infections may suggest a more serious medical problem. Next slide. And tell patient to refrain from sexual intercourse during vaginal treatment. That next, warn the patient that topical preparation may stain clothing, and tell patient that using sanitary napkin protects clothing when using vaginal preparation. Stress need to continue use of vaginal preparation. Next, tell the patient with athlete's foot to change shoes and cotton socks daily and to dry between the toes after bathing. So, para maiwasan yung fungal infection sa paa natin. No? Next is stress need to continue treatment for full course of to notify prescriber if no improvement occurs after 4 weeks. So this is according to Nursing Drug Handbook 2020. Okay, so next drug is the Nistop, and its brand name is Nistop, and its generic name is Nystatin. This is a subtype of choline macrolides. The dosage of this is 100,000 units or grams. Next slide. And its route is per oral and topical. Next is the frequency. It is usually applied 2 to 3 times a day or as instructed by a healthcare provider. So the affected areas should be properly cleansed and dried before applying this powder. Okay, so classification and mechanism of action of this drug. So Nystatin is classified as a choline antifungal medication. It belongs to the choline class of antifungals, which also includes other drugs like amphotericin B. Mechanism of action, Nystatin is channel forming ionophore, meaning it exerts its therapeutic effect via formation of a membrane spanning in the fungal plasma membranes. And the formation of this pore results in a change in membrane permeability that, next slide, that allows for leakage of intracellular contents and the subsequent disruption of electrochemical gradient necessary for proper cell functions. So selectively for fungal cells over mammalian cells is due to Nystatin's greater binding affinity for ergosterol, a K-sterol found in fungal cell walls, as opposed to its mammalian counterpart cholesterol. So this is according to Drug Bank Online 2023. So in simple terms, the mechanism of action and classification of Nistop. This is an antifungal medication that belongs to the choline class of antifungals that involves binding to ergosterol, a K component of fungal cell membranes. So this binding disrupts the integrity of the cell membranes, and leading to leakage of cellular contents and ultimately causing fungal cell to death. So Nystatin is primarily used to topically treat fungal infections, particularly those caused by Candida species. So it's commonly used to treat oral thrush, diaper rash caused by yeast, and skin fungal infection. So Nystatin works locally on the affected areas and is now well absorbed into the bloodstream, making it suitable for treating superficial fungal infections. So the indication of this drug is available in oral formulations for the treatment and prevention of oral candidiasis, so aka thrush, intestinal candidiasis, and anal candidiasis. It is indicated topically for the treatment of vulvovaginal candidiasis and other cutaneous candida infections. A combination product containing Nystatin alongside neomycin, ramecidin D, and triamcinolone or Viaderm KC is indicated in the treatment of corticosteroid responsive dermatosis caused by bacterial or candidal infections and for pruritus anivolvae. It is also available in, next slide, please. It is also available in combination with metronidazole for the treatment of mixed infections due to Trichomonas vaginalis and Candida albicans. So nystatin is also sometimes used off-label for the prevention of invasive candidiasis in low birth weight neonates, though it is generally reserved as a second-line option after fluconazole. So magagamit din siya for off-label for the pag-prevent ng invasive candidiasis sa mga low birth weight sa taas po. Okay, so the contraindications of this drug, it is contraindicated in patients hypertensive to drug. So bawal siya sa mga high blood na mga person. So rarely Stevens-Johnson syndrome has been reported. And then dialysable drug unknown, an overdose, SNS, nausea, and GI absent. So lookalike sound, don't confuse nystatin with atorvastatin, flovastatin, or any other statins. Don't confuse nystatin with nitrostat kasi magkaiba po sila ng indications and contraindications. Next is the adverse effect. So in the GI, transient nausea, vomiting, and diarrhea. Then GU, irritation, sensitization, vulvovaginal burning or vaginal form. Next is this from the skin, it is rash. Then nursing responsibility. So before, we have to do the assessment. So perform a thorough assessment of the patient's medical history, current health status, and any allergies to medication, especially antifungals. So it is very important if we perform properly the assessment sa patient natin para malaman natin ano yung mga medical history nila. Then next is medication review. So review the physician's order and medication administration record to ensure the correct dose, route, and frequency of nystatin because we really need the doctor's order for us to do the medication administration. Next is allergy check. So verify if the patient has any known allergies to nystatin or its components. Patient education, so assess the patient's understanding of the purpose of the medication and any potential side effects, address any questions or concern they may have. Kasi sometimes may mga patient na nag-hesitate sila if nag-hesitate sila if go ba sila ng treatment na yan. So we really have to assess the patient's understanding. Next is during the drug administration, we have to correct the dosage. So prepare the correct dosage of nystatin as per the physician's order. So nystatin is often available in various forms such as oral suspension, lozenges, or cream. So ensure that you are, next slide please. Ensure that you're administering the correct form. Next is the route. So administer the medication through the prescribed route, which could be oral, topical, or another route depending on the formulation and depending kung ano yung binigay ng physician. Then administration techniques. So follow proper administration techniques for oral administration. Make sure that the patient switches the oral suspension around the mouth before swallowing. For topical administration, apply the cream to the affected area with the clean hands or gloves. So we really have to make sure na in-intake ng patient natin yung binigay nating drugs para ma-assure na matitreat talaga natin yung patient natin. Next is patient monitoring. So while administering, observe the patient for any immediate adverse reactions such as allergies, itching, or difficulty breathing. So makikita naman natin yan while we are giving the medication if ano yung magiging adverse reaction nila. Next is after giving the medication, we have to document. So record the administration of nystatin accurately in the patient's medical chart, including the date, time, dosage, route, and your initials. So that is very important now. Next is patient response. So monitor the patient for any signs of improvement in their condition, such as decreased discomfort, resolutions of symptoms or reduction in fungal next. Okay, thank you. Next, growth. So side effects. So watch for any potential side effects or adverse reactions that might occur after administration. Common side effects of the statin can include mild irritation, rash, or gastrointestinal disturbances. So we really have to watch out with that. Next is the patient family teaching. So advise patient to continue taking drug for at least 2 days. Signs and symptoms resolve. Next is instruct the patient to continue therapy during menstruation. So okay lang mag-take ng medicine during menstruation para mas gagana yung drugs. Next is advise patient to report redness, swelling, or irritation. So we really have to do that in patient teaching or family teaching para malaman natin if ano yung mga naging side effects ng drugs. Then tell the patient that overusing mouthwash or wearing poorly fitting dentures may promote infection. For fungal foot infections, teach patient to dust powder freely on the feet and footwear. And next slide, please. Okay, so that is all for the nursing responsibility. So next, so I'm done now with my report.
Fluconazole is a subtype of antifungals from the brand Diflucan. It's a triazole that inhibits antifungal CYP450 that weakens the fungal cell wall. Its dosage changes from its type of medication. For injections, it's 100 milligrams up to 100 milligrams up to 400 milligrams. For powder for oral suspension, it's 50 milligrams up to 200 milligrams. For tablets, it's 50 milligrams up to 200 milligrams. So it can go either an intravenous or oral route and is usually administered 200 milligrams on the first day and 100 milligrams for 2 to 3 weeks for adults and 6 milligrams on the first day and 3 to 12 milligrams for 3 weeks for children. So fluconazole is indicated to treat fungal infections caused by yeast, oropharyngeal candidiasis, esophageal candidiasis, vulvovaginal candidiasis, systemic candidiasis. It is used to treat cryptococcal meningitis, and it also prevents candidiasis to bone marrow transplant and cancer patients. It suppresses relapse of cryptococcal meningitis in patients with AIDS. So fluconazole requires careful consideration when administered to individuals who have hypersensitivity to drug. It is contraindicated with CYP3A4 substances that may lead to QT interval prolongation. Dosage forms containing benzyl alcohol derivatives should be used with caution in neonates or avoid use. Use with caution on patients hypersensitive to other antifungal azole compounds. It can have adverse effects on different parts of the body, such as the CNS, CV, or cardiovascular, and skin. For CNS, adverse effects include headache and dizziness. For CV, it's nausea, vomiting, abdominal pain, diarrhea, taste perversion. For skin, it includes rash. As student nurses or future nurses, their responsibility is to observe the 10 rights of medication, assess for allergy to fluconazole, review past medical history, and review the medication to be administered. Use cautiously in patients with renal impairment, monitor potassium level, closely monitor patients who have mild rash, stop drug if lesions progress, and monitor renal function during treatment. Dosage adjustment may be necessary. Next slide. We also have the responsibility for patient education, where we need to tell the patient to take the drug as needed, even after feeling better, as well as to instruct the patient to report all adverse effects. Next slide. So here we have terbinafine hydrochloride, which is a subtype of antifungals from the brand Lamisil. It's an allylamine that prevents biosynthesis of ergosterol, causing a deficiency of this essential component of fungal cell membranes. Its dosage is 250 milligrams in an oral route and is usually administered once a day for 6 to 12 weeks, depending on the infection. Terbinafine hydrochloride is indicated to treat fingernail and toenail onychomycosis caused by dermatophytes. It's contraindicated with patients who have hypersensitivity to drug and its components. It is contraindicated with patients who have chronic or active liver disease, and patients may suffer life-threatening liver failure. It can have adverse effects on different parts of the body, such as the CNS, ENT, GI, hematologic, hepatic, and skin. Adverse effects for CNS include headache, pyrexia, which is a raised body temperature. For ENT, there's vision disturbances, nasopharyngitis, which is the inflammation of the nasal passages and the pharynx. For GI, it's taste disturbances, diarrhea, dyspepsia, nausea, abdominal pain, and flatulence. Flatulence is the buildup of gas in the digestive system. For hematologic, neutropenia occurs when you have too much neutrophils. We also have thrombocytopenia, which occurs when the platelet count in your blood is too low. For hepatic, we have liver enzyme elevations, and for skin, we have rash, pruritus, and urticaria. As future nurses, there's responsibility is to again observe the 10 nights of medication, assess for allergy to terbinafine hydrochloride, review the past medical history, and review the medication to be administered. You need to monitor the CBC and the hepatic enzyme levels in patients taking the drug for more than 6 weeks, especially those with immunodeficiency. Monitor and evaluate patients who develop unexplained thrombocytopenia and anemia for TMA. We also have the responsibility for patient education, which is to inform patient that successful treatment may take 12 weeks for toenail infections and 6 weeks for fingernail infections. We need to tell the patient to immediately report depression, smell, taste, vision disturbances, and persistent nausea, anorexia, fatigue, vomiting, right upper quadrant pain, jaundice, dark urine, or pale stools. Now, lastly, for griosofulvin microsize, it is a subtype of antifungals from the brand Vinmec. It enters the dermatophyte through energy-dependent transport processes. It binds to the fungal microtubules, interfering the microtubule function, thus inhibiting mitosis. Its dosage is 250 milligrams to an oral route and is usually administered every 12 hours. Griosofulvin microsize is indicated to treat fungal infections of the skin, hair, and nails that do not respond to creams or lotions. It is contraindicated in patients with porphyria, or a group of rare disorders that result from a buildup of natural chemicals, hepatocellular failure, and in individuals with a history of hypersensitivity to griosofulvin. Males should not father children within 6 months of treatment. It can have adverse effects on different parts of the body, such as the CNS, GI, and the skin. Adverse effects on the CNS include headache and dizziness. For GI, it's nausea, vomiting, and diarrhea. And for skin, it's rash. We have the responsibility to observe the 10 nights of medication, assess for allergy to griosofulvin microsize, review the past medical history, and the medication to be administered. Alcohol or marijuana or cannabis use can make the patient more dizzy and much less alert. We also have the responsibility for patient education. Patient mustn't drive, use machinery, or do anything that needs alertness until they can do it safely. Patient must avoid alcoholic beverages while they're taking this drug unless a physician gives them permission.
Okay, for the third drug type,
the antiprotozoal. So antiprotozoal refers to substances or medication that are used to treat or prevent infection caused by protozoa, so which are a single-celled microscopic organism belong to a group of parasites, so by Memon 2021. So protozoa cause disease mainly in tropical areas. So antiprotozoals tackle infection like malaria, sleeping sickness, and leishmaniasis, and targeting protozoa life cycle stages is crucial. Next slide, please. Okay, good day. So I'm Kyla Shine Jose, and now I'm going to discuss the first subtype of antiprotozoa. So the brand name is Flagyl ER. Generic name is metronidazole. So the subtype of metronidazole refers to a classification within the broader category of antiprotozoal medications, specifically known as nitromedazoles. So nitromedazoles are a class of drugs that have activity against various protozoal infection. So for the dosage, the dosage for adults is typically ranges from 250 milligrams to 750 milligrams. So depending on the specific infection being treated. And the child, um, the dosage for the children usually ranges from 35 milligrams to 50 milligrams. So depending also on the infection being treated. Now for the route of the administration. So Flagyl is available in both oral and injectable forms, so allowing for administration through the mouth or by injection. Now, for the frequency of the administration is typically 2 to 3 times a day. So the medication is usually taken every 8 to 12 hours. So depending on the infection being treated and the specific instructions provided by the healthcare provider. So it is important to follow the prescribed dosing schedule and complete the full course of treatments as directed. So for the classification and mechanism of action, metronidazole is classified as an antimicrobial agent and belongs to the nitromedazole class of drugs. So it's a primarily used on antibiotics and antiprotozoal medication. So metronidazole is antimicrobial agent, meaning it is a substance that has the ability to kill or inhibit the growth of microorganisms. So it effective against a wide range of microorganisms, including bacteria and parasites, and also exhibit antibiotics activity against a various bacteria, so including both aerobic and anaerobic bacteria. So it are particularly effective against anaerobic bacteria, which are the bacteria that can survive and grow in the environment with a little or no oxygen. So by interfering with the DNA synthesis of this bacteria, metronidazole disrupt their ability to replicate and cause their death or inhibition. So against certain protozoa, so which are the single cell parasite, and it is commonly used to treat infections caused by specific parasites such as Trichomonas vaginalis and Giardia lamblia. Now, for the exact mechanism of the action of metronidazole is not fully understood, but there are several proposed mechanisms based on the current knowledge. So one of the proposed mechanisms involves the reduction of metronidazole by anaerobic bacteria and protozoa, so leading to production of the toxic metabolites. So after administration, metronidazole enters a cells through the passive diffusion, so inside the cell, specific enzyme called a ferredoxin or flavodoxin, so which are produced by anaerobic or the microphilic microorganism, act on the metronidazole. Okay, so these enzymes reduce the nitro group present in metronidazole to form nitro radicals. So the redox potential of the electron transfer system in the anaerobic or the microphilic microorganisms makes them selectively susceptible to the reduction of metronidazole. So this reduction process generates toxic metabolites, and so including the N2-hydroxyethyl oxamic acid and acetamide. So these toxic metabolites have the potential to damage the DNA and the other essential cellular components of replicating the microorganism by interfering with the nucleic acid synthesis and other vital process. And metronidazole inhibits the growth and the replication of the microorganism and ultimately leading to their elimination. So it is important to note that the specific details of metronidazole mechanism of action may vary depending on the particular microorganism being targeted. So the drug's ability to selectively act on the anaerobic bacteria and a certain protozoa is attributed to their unique metabolic process and electron transport system. Okay, for the indication, metronidazole is indicated for the treatment of confirmed trichomoniasis caused by Trichomonas vaginalis, except for in the first trimester of the pregnancy. So, and the patients are sexually partners, bacteria vaginis, certain types of ambiasis, and a various anaerobic infection. The above anaerobic infection may occur on the skin and skin structures, the abdomen, the heart, reproductive organs, central nervous system, and the respiratory system. So some may also be present in the bloodstream in the cases of, next slide, please. So in the cases of septicemia, so common infection treated by metronidazole are the Bacteroides species infections, Clostridium infection, and Fusobacterium infection, as well as the Peptococcus and Peptostreptococcus infections. So typical formations of metronidazole are indicated for the treatment of the inflammatory lesions of rosacea. So it also used off-label in the treatment of the Crohn's disease as a prophylactic agent after surgery, and in the treatment of Helicobacter pylori infection. It has been studied in prevention of preterm births. So next slide, please. Okay, so and then to treat periodontal disease, so by drug bag thinking. Okay, for the contraindication. So contraindication are the specific situation or condition in which the use of particular medication is not recommended or should be avoided due to potential risk of adverse effects. So in the case of metronidazole, there are a certain contraindication to be aware of. So contraindicated in patient hypersensitive to drug or other nitromedazole derivatives. So the use of the dosiform within 2 weeks of metronidazole therapy, and the use of alcohol of properly glycol products during the treatment and for 3 days after treatment ends are contraindicated. So metronidazole is contraindicated in patients who are hypersensitive or allergic to the drug itself or other nitromedazole derivatives. So allergic reaction to metronidazole can range from the mild skin rashes to more severe reaction like anaphylaxis. So it is important to avoid the use of metronidazole in individuals with a known hypersensitivity to prevent this adverse reaction. And the disulfiram is a medication used to treat a chronic alcoholism by causing unpleasant symptoms when alcohol is consumed. So the concurrent use of the disulfiram within 2 weeks of a metronidazole therapy is contraindicated. So this combination can lead to a reaction known as disulfiram-like reaction, so which can cause symptoms such as severe nausea, vomiting, headache, flushing, and a rapid heartbeat. So during the treatment of with the metronidazole, the use of alcohol or the product contains a propylene glycol is contraindicated. So alcohol and propylene glycol can interact with the metronidazole and lead to a disulfiram-like reaction. And it is recommended to avoid consuming alcohol or using a product contains propylene glycol during the metronidazole treatment and for at least 3 days after completing the treatment course. Okay, so when it comes to the use of metronidazole during the pregnancy, lactations and reproduction, so there are the important consideration to keep in mind that metronidazole is contraindicated during the first trimester of pregnancy. And the first trimester is a critical period of fetal development, and the safety of the metronidazole during time has not been fully established. So it is important for pregnant women to consult with their healthcare provider and follow the current guidelines for appropriate use of metronidazole during the pregnancy. So the healthcare provider will carefully weigh the potential benefits, again, a potential risk to determine the if the metronidazole is appropriate in specific cases. So um, metronidazole can pass into breast milk. So therefore, it is generally recommended that breastfeeding be discontinued while taking the metronidazole, and the presence of metronidazole in breast milk may expose the infant to the medication, and the effects on the infant are not well studied. So however, each situation is unique, and a healthcare provider can provide guidance based on the specific circumstances and alternative option for the matter. So for the adverse effect, so metronidazole, like any medication, can be associated with a various of adverse effect. So we have here the central nervous system. So headache, seizures, fever, vertigo, ataxia loss. This is ataxia loss of a muscles coordination, dizziness, syncope of fainting, incoordination, confusion, irritability, depression, weakness, insomnia, and peripheral neuropathy. So, peripheral neuropathy or the nerve damage in the extremities, so have been reported. So this the central nervous system side effects are generally rare but occur especially at higher doses or with the prolonged use. So next is the cardiovascular system. Metronidazole can cause changes in the electrical activity of the heart, leading to flattened T wave on the electrocardiogram or ECG, edema, fluid retention, and flushing or redness and warmth of the skin, so may also occur. In some cases, thrombophlebitis and or the inflammation of the vein with the blood clot formation, so has been reported after the intravenous or IV infusion of the metronidazole. Next is EENT or the eyes, ears, nose, and throat. So some individual may experience rhinitis or inflammation of the nasal passages and sinusitis or inflammation of the sinuses or pharyngitis or inflammation of the throat. So a side effect. So this is a side effect of metronidazole. And the gastrointestinal, as common GI side effect include the nausea, um, abdominal cramping or pain, stomatitis or inflammation of the mouth, epigastric distress or discomfort in the upper abdomen, the vomiting, anorexia or loss of appetite, diarrhea, constipation, proctitis or inflammation of the rectum, dry mouth, and the metallic taste in the mouth. Next is the genitourinary or GU, metronidazole can cause a various effect on the genitourinary system. So this includes the vaginitis, inflammation of the vagina, the dark urine, polaria or increased urine production, dysuria or a painful urination, cystitis or inflammation of the bladder, the dyspareunia or the painful of sexual intercourse, dryness of the vagina and vulva, candidiasis or the yeast infection, genital pruritus or itching, urinary tract infection or UTIs, and dysmenorrhea or the painful menstruation. Rather. So the hematologic metronidazole may lead to the transient leukopenia. So this is reduced with the white blood cells count, and neutropenia, so reduce neutrophil count, although these hematologic side effects are generally rare. So next is the musculoskeletal, and so transient joint pains have been reported as an adverse effect of metronidazole. Now next slide, please. So we have here the upper respiratory tract infection may occur as a side effect, and skin rash and genital pruritus or itching are possible skin-related side effect of metronidazole, and other decreased libido or reduced sexual desire, overgrowth of a non-susceptible organism or especially candida species, leading to yeast infection, and flu-like symptoms have been reported. So it is important to note that not all individuals will experience these adverse effects, and the occurrence and severity may vary. So if any concerning or the persistent side effects are experienced while taking the taking the metronidazole, it is important to contact a healthcare provider for the further evaluation and the guidance. So, and balik. So next is the nursing responsibilities. So before the medication assessment, we need to review the patient medical history, including the allergies, current medications, and any persisting medical condition that might affect the use of metronidazole. So by conducting the comprehensive assessment of the patient medical history, and the healthcare professionals can identify any potential contraindications, drug interactions, or a special consideration that may impact the safe and effective use of metronidazole. So this information guides treatment decisions and minimize the risk of adverse reactions and promotes the optimal patient outcomes. And the patient's education, and we need to explain the purpose of the metronidazole. So it a mechanism of the action and the expected benefits of the treatment. Discuss potential side effect, risk, and benefits with the patient to ensure they understand the medication. So by providing the comprehensive patient education, healthcare profession enable patients to active participate in their treatment journey. So increased understanding empowers the patient to recognize the therapeutic value of metronidazole and adhere to the prescribed regimen, or promptly report any concern of side effect, and engage and share the decision making with their healthcare provider. And next, the allergy check. So we need to confirm if the patient has any known allergies to metronidazole or other medication in the same class. And medication review, so review the physician's order and the medication administration record to ensure the correct dosage, route, and a frequency of the metronidazole. And now for during the medication, so correct dosage, so we need to prepare and administer the prescribed dosage of metronidazole according to the healthcare provider's order. And the dosage can vary based on the patient condition and the type of infected being treated. And now for the administration technique administered, so metronidazole orally are directed in some cases. So it might be administered intravenously in the healthcare setting, and the patient comfort and education ensure that the patient is comfortable during administration and instruct them to swallow the medication properly. And the case of the intravenous administration ensure that the patient understands the process and is informed about any potential side effect of a sensation. And for after medication, monitoring observe the patient for any immediate adverse reaction such as allergic responses or the gastrointestinal disturbances. And documentation, we need to accurately document. So the administration of the metronidazole in the patient, medical record, and including the date, the time, the dosage, and the route to your initials. And the patient response, monitor the patient's response to treatment, and including any improvement in symptoms associated with the infection being treated, and ongoing assessments to monitor the patient for potential side effects such as gastrointestinal upset or the neurological symptoms, and promptly report any adverse reaction to the healthcare provider. Next slide, please. So last is the patient education. So reinforce the importance of the completing the full course of metronidazole as prescribed and following any additional instruction provided by the healthcare provider. And for the patient or the family teaching, so we need to instruct the patient to take extended release tables at least 1 hour before, 2 hours after meals, but to take all other oral forms with the food to minimize GI upset. And we need to inform patient with the trichomoniasis of need for a sexual partner to be treated and simultaneous to avoid infection, and also to tell patient to avoid alcohol. And alcohol contains drugs during the at least 3 days after treatment course, and tell the patient that a metallic taste and a dark or a red-brown urine may occur, and tell the patient to report the prescriber symptoms of candidal overgrowth, and tell the patient report all the adverse reaction to prescribe immediately, especially any neurological symptoms like seizures, peripheral neuropathy. Okay, so next. So now for the Daraprim, or the broad name, Daraprim, or generic name. The generic name is pyrimethamine. So anti-malaria pyrimethamine is a medication primarily used for the treatment and prevention of malaria, a parasitic infection caused by a Plasmodium species, and it belongs to the class of medication known as antiprotozoals, so which are the drugs used to treat infection caused by protozoan parasite. So for the dosage, the initial dosage for adult is typically 50 to 75 milligrams of ferritamine taken in combination with 1 to 4 grams of a sulfonamide medication. And the dosage of the children usually 1 milligram per kilogram of body weight per day. So, however, the specific dosage may vary depending on the condition being treated and individual patient circumstances. Now for the route, the Daraprim administration orally, which means it taken by mouth. And the frequency of the administration will depend on the specific condition being treated and the individual patient circumstances. So the healthcare provider will determine the appropriate frequency for taking the Daraprim based on the patient needs. So for the classification and mechanism of action, pyrimethamine is classified as a medication belonging to the pharmacological class of antiparasitic drugs. So more specifically, it is categorized as antiprotozoal agent. This is a primary use for the treatment and prevention of protozoal infection, particularly malaria caused by Plasmodium falciparum, and this also effective against other protozoal infections, and such as toxoplasmosis and the pneumocystis pneumonia, and commonly seen in the immune-compromised individuals. And for the mechanism of action, pyrimethamine inhibits the dihydrofolate reductase of the plasmodia and thereby blocks the biosynthesis of the purines and pyrimidines, which are essential for DNA synthesis and the cell of multiplication. So this leads to failure of the nuclear division at the time of the schizone formation in the erythrocytes and liver. So for the indication, pyrimethamine is indicated for the treatment of the toxoplasmosis and acute malaria. So as well as for the prevention of malaria in areas where the malaria parasite is not resistant to pyrimethamine. So and toxoplasmosis is an infection caused by the protozoan parasite. So Toxoplasma gondii. So pyrimethamine is used typically in a combination with the other medication, like sulfadiazine for the treatment of this infection, and it works by inhibiting the enzyme dihydrofolate reductase or in the parasites, which disrupt its ability to replicate and survive, and this help to control the infection and elevate the symptoms associated with the toxoplasmosis. Toxoplasmosis. So for the contraindication, in a patient have known a hypersensitivity or allergy to the pyrimethamine, pyrimethamine, sorry. So any component of the formulation, hypersensitivity reaction can range from the mild skin rashes to severe allergic reaction, including the anaphylaxis. Patient with a history of the hypersensitivity to a pyrimethamine, pyrimethamine should not use this medication. So, this contraindicated in a patient with the documented megaloblastic anemia caused by a folate deficiency. And megaloblastic anemia is a type of anemia characterized by the production of abnormal large and immature red blood cells. So, pyrimethamine inhibits the enzymes dihydrofolate reductase or DDHFR, which involve in the synthesis of folate, and patient with the megaloblastic anemia due to folate deficiency. The use of pyrimethamine can further impair for folate metabolism and worsen the anemia. So it is important for the healthcare provider to be aware of this contraindication, carefully evaluate patient for any known hypersensitivity or underlying megaloblastic anemia before prescribing pyrimethamine. So pyrimethamine, like any medication, so can have several adverse effects across a different body systems. So first is the central nervous system effects of pyrimethamine can cause CNS stimulation, so leading to the symptoms such as restless, irritability, seizures, tremors, ataxias, fatigue, and fever. And for the cardiovascular effect, pyrimethamine has the potential to cause abnormal heart rhythm, dysrhythmias, or monitoring cardiac function is important during the treatment. So the gastrointestinal effect, these are common GI side effect of the pyrimethamine. So some individual may experience a loss of um, a appetite or anorexia while taking the pyrimethamine. So use may lead to diarrhea, can cause inflammation of the tongue or the atrophic glossitis and stomach lining or gastritis. So the hematological or HEMA effects, pyrimethamine can cause a decrease in the number of platelets or the thrombocytopenia, the leukopenia, the pancytopenia, megaloblastic anemia, decreased folic acid, and granulocytosis. And for the integumentary effect, pyrimethamine may cause skin rashes or eruptions. Some individuals may experience increased sensitivity to sunlight or the photosensitivity. And Steven-Johnson syndrome, so which is a potentially life-threatening condition involving the extensive skin blistering and a mucosal involvement. And respiratory effect, in rare case, pyrimethamine has been associated with the respiratory failure, which is a severe condition where the lungs fail to function adequately. So it is important to note that this adverse effect may not occur in every individual taking pyrimethamine. However, if any of these side effects occur or if worsen, it is essential to seek a medical attention promptly. Next, for the nursing responsibility, before assessment, review the patient medical history, including the allergies, current medication, and any pre-existing medical conditions that might affect the use of daraprim. And patient education, explain the purpose of daraprim. It is a mechanism of action and the expected benefits of the treatment, and discuss the potential side effect, risk, and benefits with the patient to ensure they understand the medication. And allergy check to confirm if the patient has any known allergies to the, daraprim or other medication. And medication review, so review the physician's order and medication administration record to ensure accurate dosage rules and the frequency of the daraprim. And during the medication, so correct dosage, we need to prepare and administer the prescribed dosage of daraprim according to healthcare providers' orders, and dosage can vary based on the patient condition and the type of infection being treated. And administration technique, administer daraprim orally as directed. It's important to ensure that patient swallows the medication properly, and patient comfort and education need to ensure that the patient is comfortable during the administration and instruct them on a proper administration technique, and especially if they are taking multiple medication. And for after medication monitoring, observe the patient for any immediate adverse reaction or discomfort after taking and daraprim. So for documentation, we need to accurately document the administration of daraprim in the patient medical record. So including the date, the time, the dosage, the route, and any initials. And a patient response, so monitor the patient response to treatment, including any improvement and symptoms related to the infection being treated. And going assessment, we need to monitor the patient for a potential side effect, such as a gastrointestinal upset or allergic reaction, and report any adverse reaction promptly. So for the patient education, so we reinforce the importance of completing the full course of daraprim as a prescribed and following any additional instructions provided by the healthcare provider. And for the patient family teaching, so we need to report visual problems, fever, fatigue, bracing, and bleeding, sore throat may indicate a blood dyscursias. Next. No, so next drugs is a brand name, Alinea ambos or the Balsalfex, and the generic name is nitazoxanide. So this belongs to the pharmacological class of antiprotozoal drugs. It is especially indicated of the treatment of a certain protozoal infection. So the dosage forms, nitazoxanide is available in a two dosage forms. The oral powder for the reconstitutions, it available as a powder that needs to be mixed with the water for oral administration. So each 5 ml of reconstituted solutions contains 100 milligrams of nitocyanide. An oral tablet, nitoxazoxanide is also available as an oral tablet with a strength of 500 milligrams. And the route of administration by mouth, so it's taken orally, which means it is ingested by mouth. And for frequency of nitazoxanide for the treatment of certain protozoa infection, so as follows the oral powder reconstitution. So the recommended dose is administered with the food every 12 hours for duration of 3 days. For the oral tablet, is the specific dosage instructions for the tablet forms may vary depending also to condition being treated. So it is important to follow the instruction provided by the healthcare provider or the prescribing information. Now for the classification and mechanism of action. Um, Nitazoxanide belongs to the class of drugs known as thiazolide. So, nitazoxanide is a broad of spectrum anti-infective drug that markedly modulates the survival, growth, and proliferations of a range of extracellular and intracellular protozoa, helminths, anaerobic, and microaerophilic bacteria, in addition to viruses. So this drug is effective in the treatment of a gastrointestinal infection, including the Cryptosporidium parvum and the Giardia lamblia in healthy subjects. So for the mechanism of actions, nitroxaxonides is a drug with a versatile mechanisms of actions and disrupts energy metabolism in anaerobic microbes by inhibiting the pyruvate ferredoxin, flavoxin, oxidoreductase or PFOR cycle. So it also damages cells membranes and depolarize, depolarizes the mitochondrial membrane in the parasitic protozoa. And NTZ inhibits the enzymes involved in cellular process and exhibits. Next slide, please. The antibacterial effect by targeting the pyruvate dehydrogenase or membrane potential, pH homeostasis, and the chaperone or usual pathway in the bacteria. So it has antiviral properties by inhibiting the viral hemagglutinin maturation, viral transcription factors, IE2, and activating the intracellular antiviral proteins. Moreover, NTZ inhibits the tumor cell progression by altering drugs, dexamethasons, modulating cellular responses such as enfolded protein response and a autophagy, suppressing the cytokines, inhibiting the CMYS, MYC or protein related to cell growth. So overall, NTZ acts out through various mechanisms to disrupt the microbial metabolism, inhibit enzymes, suppress viral replication, and inhibit tumor cell growth. Now for the indication, nitazoxanide is indicated for the treatment of the diarrhea in the adults and the children caused the protozoa Giardia lamblia. So it also indicated for the treatment of diarrhea in children caused by protozoan Cryptosporidium parvum. And nitroxaxonide can effectively treat diarrhea caused by Giardia lamblia, a protozoa parasite that commonly infect the intestine. It works inhibiting the growth and the proliferation of the parasite, leading to the resolution of diarrhea symptoms. And also indicated for the treatment, the diarrhea caused by the Cryptosporidium parvum in the children is another protozoan parasite that can cause gastrointestinal infection, and nitazoxanides helps to reduce the duration and severity of the diarrhea caused by these parasites. So nitazoxanide has not been shown to be a superior to the place medication for the management for diarrhea caused by the Cryptosporidium parvum in a patient with the HIV or the immunodeficiency. So it means that in clinical studies, the use of the nitazoxanide did not demonstrate a significant advantage over a placebo or the inactive substance in treating the diarrhea caused by Cryptosporidium parvum, specifically in a patient who have HIV or the immunodeficiency. Now for the contraindication, in patients who have a known hypersensitivity or allergy to nitrosoxanides or any of its components, if a patient has previously experienced an allergic reaction or the hypersensitivity to nitrosoxanide, it should not be used. So it should be used with the cautions in the patients who have a renal or kidney or hepatic or liver dysfunction. Patients with the impaired kidney or liver function may experience altered metabolism or elimination of the drugs, which could potentially lead to the adverse effects. So, close monitoring and dosage adjustment may be necessary in these patients. So, the safety and effectiveness of nitazoxanide have not been established in specific patient populations. So, this includes HIV positive patients, other immunodeficiency patients beside HIV, and infants younger than 1 year of age. So there are limited information available on the use of nitazoxanide in these populations, and a further research is needed to determine its safety and efficiency in this specific group. So is it important for the healthcare professionals to consider these contraindications and precautions when prescribing nitazoxanide? They will assess the patient's medical history, current health status, and also potential risks of versus benefits before making the treatment decision. So if there are concerns of the uncertainties on consultations with the specialist or the infectious disease expert may be recommended. For the adverse effect, the central nervous system of the dizziness. So some individual taking the nitazoxanide may experience dizziness, which is a sensation of the lightheadedness or the unsteadiness. It is important to be cautious when performing activities that require alertness, such as driving or operating machinery while experiencing dizziness. We have the eyes, ears, nose, throat, the yellow eye discoloration, the gastrointestinal, abdominal pain, diarrhea, vomiting, um, genital urinary, the discolored urine. So it causes temporary discoloration of urine, resulting in a change in a color to darker shade. So this affects harmless and typically resolves after the treatment discontinuation. And derm or dermatological, pruritus or sweating, and miscellaneous fever. For the nursing responsibility, before medication assessment, review the patient medical history, allergies, and the current medications to ensure there are no contraindications or interaction with the nitazoxanide. So the patient indication explain the purpose of nitazoxanide, its mechanism of actions, and the expected the benefits of the treatment, and discuss the potential side effect, risk, and benefits with the patients to ensure they understand the medication and allergy check. It confirmed if the patient has any known allergies to nitazoxanide or related medication. And for the medication review, we need to review the physician's orders and medication administration record to ensure the accurate dosage and the frequency of nitazoxanide. And during the medication, we need to prepare the administer the prescribed dosage of nitazoxanide according to the healthcare provider's order. And dosage can vary based on the patient's condition and the type of infection being treated. And administration technique, administer the nitazoxanide orally is as a directed, and it's important to ensure the patient swallows the medication properly. And patient comfort indication, ensure that the patient is comfortable during the administration and instruct them on the proper administration techniques. And for after medication, we need to observe the patient for any immediate adverse reactions or discomfort after taking the nitazoxanide. And for documentation, accurately document the administration of the nitazoxanide in the patient medical record, including the date, the time, the dosage, and the route, and your initials. And the patient response, monitor the patient response to the treatment, including any improvement in symptoms related to the infection being treated. And ongoing assessment, monitor the patient for the potential side effect and report any adverse reaction promptly. And patient education, we need to reinforce the importance of the completing the full of course of the nitazoxanide as a prescribed and following any additional instructions, provide the healthcare provider and for the patient or the family teaching, tell the caregiver or the patient to give a drink with the food, instruct the caregiver or the patient to keep the container tightly closed and to shake it well before each use. And advise a caregiver or patient that the drug may be stored at room temperature, and advise caregiver or the patient to discard suspension after 7 days. And also inform the diabetic and patient or his a caregiver that the suspension contains 1.48 grams of the sucrose per 5 ml. So that's it. And for the further um discussion, the next reporter is Miss Pia Rucolas.
So the next drug for antiprotozoal is pentamidine isethionate. So its brand name is nibopentan, and then the subtype of this drug is diamidine derivatives. Its dosages is for adults and children aged 4 months and older, 4 mg for intravenous or intramuscular injection. So adults 300 mg by inhalation. For the route, it is taken intravenously, intramuscularly, and inhalational. So for the frequency, for the IV or IM, 4 mg once daily for 14 to 21 days, then inhalation, 300 mg once every 4 weeks using respiratory guard to nebulizer. So for the classification and mechanism of action, so pentamidine isethionate is primarily used for to treat infections caused by protozoan parasites. So it is often indicated by prevention and treatment of pneumocystis jirovecii pneumonia or known as PCP, a fungal infection that can affect individuals with weakened immune systems such as those with HIV or AIDS. So when we say pneumocystis jirovecii pneumonia, it is a fungal infection of the lungs. So the disease used to be called pneumocystis carinii or PCP pneumonia. So the AIDS acquired immune deficiency by syndrome is caused by human immunodeficiency virus and is syndrome that leaves the body vulnerable to a host of life-threatening illness. So for the indication, so this medicine is used for pneumocystis jirovecii pneumonia to prevent P. jirovecii pneumonia in high-risk patients. So for the contraindication, so it may be harmful for the patients with history of anaphylactic reactions to drugs, and use cautiously in patients with HTN or hypertension, hypoglycemia, hypocalcemia, leukopenia, thrombocytopenia, anemia, diabetes, pancreatitis, Stevens-Johnson syndrome, hepatic or renal dysfunction. Then we have to remember that severe hypotension may occur after a single intravenous or IM or intramuscular dose. So monitor patients closely. And then for dialysable drug, there is no dialysable drug of this. And then overdose, SNS, so renal and hepatic impairment, hypotension, cardiopulmonary arrest. So this is according to Nursing Drug Handbook 2020. So for the adverse effect, so it means kung abnormal use of drugs. So for the central nervous system, so this drug can cause confusion, hallucinations, headache, sakit sa ulo, and CV, so chest pain, hypotension. Then for the gastrointestinal tract, so nausea, vomiting, metallic state, diarrhea, pananakit ng tiyan, anorexia. So anorexia is an eating disorder that causes people to weigh less than is considered healthy for their age and height, usually excessive weight loss. So hematologic, leukopenia, it is an abnormal reduction of circulating white blood cells, especially the granulocytes. Thrombocytopenia, so it is a deficiency of platelets in the blood. Then anemia, so it is a condition that develops when your blood produces a lower normal amount of healthy red blood cells. Sa metabolic naman, hypoglycemia. So this occurs when the level of glucose in your blood drops below what is healthy for you. So for many people with diabetes, this means a blood glucose reading lower than 70 milligrams per deciliter. So for the respiratory naman, ang adverse effects nito is cough, so pag-uubo, wheezing. So when we say wheezing, it is a sign that a person may having a problem in breathing. Then for skin naman, rash, sterile or necrosis, pain or induration of site of intramuscular injection. So when administering intramuscular injection, nagkaka-rashes siya. So other naman, night sweats, so pawis sa gabi, then infection. So for the nursing responsibility, we have here the assessment. So we have to remember to review the patient's medical history, allergies, and current medications. This is for us to know the contraindications or identify and potential interactions with this specific drug, and then assess the patient's respiratory status and the presence of any signs or symptoms related to fungal infections. So we really have to assess the patient's status or respiratory status. Then baseline assessment, so measure the patient's vital signs, including temperature, heart rate, respiratory rate, and blood pressure to establish baseline values. So hindi natin ibibigay itong drug na to pag yung patient natin is having a high blood pressure and having a abnormal heart rate or respiratory rate. Then patient education, so we have to explain the purpose of this drug or kung paano to nagwo-work and the expected outcomes of the treatment, kung paano sila, kung ano yung magiging expectation nila pag nilalagay na to or binibigyan na tong drug na to. Next is inform the patient about possible side effects, adverse reactions, and the importance of adhering to the prescribed treatment regimen. So importante na malaman ng mga pasyente kung ano yung mga side effects, mga reactions, and mga importanteng kailangan nilang malaman sa this specific drugs. Next is the allergy check. Next slide, please. Verify whether the patient has any known allergies to pentamidine isothianate or related medication. So we really have to verify if may allergy ba ang patient sa this type of drugs. Then review the physician's order and medication administration record to ensure accurate dosage, route, and frequency of pentamidine isothianate. So we really have to review first so that this is for us to have an accurate medication administration to the patient. So during naman ng nursing responsibility, we have to prepare and administer the prescribed dosage of this specific drug according to the healthcare provider's order. So dosages can vary based on the indication and patient's factor. So ina-adjust yan minsan ng mga physicians ang dosages kung ano yung mas better na dosage for the patient. Next is administration technique. So we have to administer this drug as per the prescribed route, which is typically by intravenous infusion or by inhalation through a nebulizer. So follow a sterile technique during IV administration and proper technique for nebulizer administration. So if kailangan natin magsuot ng sterile gloves, we really have to, and then we have to perform hand hygiene before and after any procedure. Next, for monitoring, next slide, please. So during this administration or intravenous administration, closely monitor the patient's vital signs, infusion site, and for any signs of adverse reaction such as hypotension or fever. Okay, so during nebulizer administration naman, we have to ensure the patient's comfort and observe for any immediate respiratory distress. So we really have to observe during IV and nebulizer administration. After naman, we have to monitor. So continue to monitor the patient's vital signs and respiratory status after administration to detect any delayed reactions. And then documentation, accurately document the administration of pentamidine isotoniate in the patient's medical record. Include details such as the date, time, dosage, kung ano yung nilagay mo, route, kung saan mo for the IV route, and your initials. Next is for the patient response. So observe the patient for clinical improvement, including resolutions of symptoms related to the fungal infection. So kailangan nating mag-observe sa patient kung ano yung kung ano yung naging reaction niya during your administration of the medication. Next is for the patient education. We have to provide post-administration instructions to the patient, including any follow-up. Next slide, please. Appointments or additional treatments. So yes, this is important for us to have kailangan malaman ng patient kung ano yung mga appointments or additional treatments na kailangan pa after the administration. Next is adverse reaction. So educate the patients about potential adverse reactions and side effects. Instruct them to report any unusual symptoms to the healthcare team. So this is important. So para malaman naman ng patient kung ano yung mga potential and adverse reactions or side effects while putting that specific drug. Then patient and family teaching. So instruct patient to use the aerosol device until the chamber is empty, which may take up to 45 minutes. So warn patient that intramuscular injection is painful. So kailangan nating sabihin sa patient na masakit yung intramuscular injection while giving this drug. Then instruct the patient to complete the full course even if feeling better. Next is tell patient to report signs and symptoms of pulmonary infection such as shortness of breath, fever, or cough. Kailangan nating malaman na may problema or may pulmonary infection yung patient natin para kaagad naman nating masolusyonan yung problem nila for shortness of breath or fever or cough. Next slide, please. Okay, so the next drug for antiprotozoal is tenidazole. So its brand name is Tendamax. Then this is a subtype of antiprotozoals. So the dosages is 2 grams and the route of this specific drug is oral. The frequency naman is 2 grams orally once a day. The classification and mechanism of action. So tenidazole belongs to the class of medications na kilala bilang antiprotozoal agents. It is specifically ginagamit to treat infections na caused by protozoan parasites. So tenidazole is primarily used for the treatment of infection caused by various protozoa, including Trichomonas vaginalis, which can cause trichomoniasis, Giardia, Lamblia, and Entamoeba histolytica. So we all know this type of parasites kasi na-take up natin to last year sa microbiology and parasitology. Then mechanism of action. So the tinidazole is a prodrug and antiprotozoal agent. The nitro group of tinidazole is reduced trichomonas by a pyridoxine-mediated electron transport system. So, yun. The free nitroradical generates as a result of this reduction is believed to be responsible for the antiprotozoal activity. So it is suggested that the toxic free radicals covalently bind to DNA, causing DNA damage and leading to cell death. So yun yung mechanism of action niya. So the mechanisms by which tinidazole exhibits, next slide please, exhibits activity against Giardia and Entamoeba species is not known, though it is probably similar. So hindi pa siya known, but pareho sila, and yeah, pareho sila ng specific na species. Then indication. So for the treatment of trichomoniasis caused by Trichomonas vaginalis in both female and male patient, also for the treatment of giardiasis caused by G. duodenalis in both adults and pediatric patients older than 3 years of age, and for the treatment of intestinal amoebiasis and amoebic liver abscess caused by Entamoeba histolytica in both adults and pediatric patients older than 3 years of age. This is according to the Drug Bank Online 2023. So that is the medicine use of tinidazole. Next is for the contraindications. So when we say again contraindications, it should not be used because it may be harmful to the person. So contraindicated in patients hypertensive to drug, it is its component or other nitromenadazole derivatives. So use cautiously if patients with central nervous system disorders, the elderly, and in those with blood dyscrasia, or hepatic dysfunction. Dialysable drug, 43% in 6 hours. This is according to the nursing drug handbook. So bawal siya for hypertensive patient. Adverse effect. So the adverse effect of this drug is abnormal result of this type of drug. So since central nervous system, so seizures, dizziness, fatigue, headache, and malaise. So malaise is a general feeling of discomfort, illness, or lack of well-being. Weakness, so kahinaan niya. So may effect niya is nagiging mahina yung person na nagtitake ng this kind of drugs. Next is gastrointestinal, so anorexia. So when we say anorexia again, it is eating disorder. Next is constipation, pananakit ng tiyan. Then cramps, so sakit ng puson. Then diarrhea, pananakit ng tiyan. Abdominal pain rather. So pananakit ng abdomen. Dyspepsia, so dyspepsia is indigestion kapag napasobra ang kinain o kung may nakain hindi angkop sa sikmura. So metallic state, then nausea, vomiting, decreased appetite. It is when your desire to eat is reduced. Next is flatulence. It is the medical term for passing gas through the anus, and it is also known as farting. Farting is also known as flatulence or wind, and it is considered normal, but sometimes it can be a sign of a health condition. Next is for the GU. UTI or urinary tract infection. Then next is painful in urination. So the adverse effect of this type of drugs is painful in urinating. Then urine abnormality. So abnormality in urine is that color may be caused by infection, disease, or medicines or food you eat. Then next is the pelvic pain. So pananakit ng pelvic area. Then vulvovaginal discomfort. Next is the menorrhagia. So menorrhagia is a heavy or prolonged menstrual bleeding especially in many women. So women have this type of abnormal uterine bleeding. It can be related to a number of conditions, including problems with the uterus, hormone problems, or other conditions. But sometimes natitrigger siya sa tinidazole drug. Then the respiratory, upper respiratory infection, also known as the common cold, is one of the most common illnesses, leading to more primary care provider visits and absences from school and work than any other illness every year. So URI. So for the nursing responsibility, so before, we have to review the assessments, review the patient's medical history, allergies, and any contraindications to tinidazole. Next is to assess the patient's current condition and ang reason for prescribing this type of drug, and check for any potential drug interactions with other medications the patient is taking. Next is the patient education. So we have to inform the patient about kung anong purpose ng this drug and its potential side effects. Next is to provide instructions on how and when to take the medication. So kailangan mag-instruct tayo sa patient kung paano and kung kailan iti-take ang medication. Next is emphasize the importance of completing the full prescribed course even if symptoms improve. We really have to emphasize that one. Next is for the medication verification. So check the medication order against the prescription to ensure accuracy. So nasa 10 rights of medication administration yan. Next is verify the correct dosage, route, and frequency of administration. So kailangan natin tingnan yung doctor's order. So during the administration of medication, we have to wash our hands and ensure proper hygiene measures. And after that, we have to gather all necessary supplies, including the tinidazole tablets, water, and any other required equipment during the medication administration. Next is for the patient identification. We have to verify the client's identity. This is done for us to know na tama yung or right client yung pinasukan natin. Then we have to identify them using their names and date of birth. So kailangan natin tanungin, ma'am, ano yung name nyo and kailan yung date of birth nyo, and kailangan sila sa kanila galing mismo yung sa kanila galing yung name nila and date of birth pag magko-question tayo. Then administration, we have to administer the tinidazole tablet orally as prescribed. Offer the patient a glass of water to help with swallowing the tablet. Then after that, we have to ensure the patient is comfortable and in appropriate position of swallowing. So in administering the medication, we have to bigyan natin ng tubig yung patient, and kailangan natin silang i-ensure na nakakaswallow sila ng tama, and then we have to position them in appropriate position for swallowing. Then after that, after that medication administration, we have to monitor. So observe the patient for any immediate adverse reactions or allergies after administration. Kailangan natin tingnan if ano yung mga reactions ng body nila after na intake yung specific drug. Then monitor vital signs. So kailangan pa din natin i-monitor ang vital signs nila if necessary, especially if the patient has a history of severe allergic reactions. So especially sa mga patient na may mga allergies. Next is documentation. We have to document the administration of tinidazole in the patient's medical record. So we have to include the date, time, dose, route, and any relevant observations na kailangan nating i-document para if ever hingi ng doktor yung documentation natin, may maipakita tayo. The next is the patient education. We have to reinforce any post-administration instructions such as food or drink restrictions, discuss potential side effects that the patient should report. So, kailangan natin mag-reinforce ng this type of post-administration and instruction kung ano ba dapat or kung ano yung bawal na kainin nila or kailangan na i-intake nila na drinks. Next is follow-up. We have to schedule any necessary follow-up, appointments, or assessments based on the patient's condition and the treatment plan. So, usually mga doktor to. So, mga doktor yung nag-schedule ng plan. So, next is the patient and family teaching. So, we have to tell the patient to take drug with food. So, tell patient to report to prescribers seizures and numbness in arms or legs. So, kailangan din natin sabihin sa kanila na mag-report sila ng any types of discomfort like seizures and numbness sa kamay at legs nila. Next is warn a patient not to drink alcohol or use alcohol-containing products while, next slide please, while taking drug and for 3 days afterward. So, bawal sila mag-take ng any types of alcohols kasi when taking this type of drugs, ipinagbabawal talaga siya para mas maging effective yung drugs. Then, advise female patient to immediately notify prescriber if she becomes pregnant kasi usually this type of drugs bawal siya sa mga pregnant women kasi nakaka-apekto ito sa fetus ng women, ng buntis. Then tell the patient or the female patient to stop breastfeeding during therapy and for 3 days after final dose. So, kailangan natin sabihin sa buntis na mag-stop sila ng breastfeeding during therapy. This is for the safety of their baby and their infant. So next is if patient is being treated for a sexually transmitted infection, explain that patient's sexual partners should be treated at the same time. So if ang partner natin or if ang patient natin is may partner siya and then siya is being treated siya sa sexually transmitted infection or known as STI, so kailangan natin explain both the partner and both the patient and the partner of the patient na kailangan mat-treat din yung partner ng patient. So that concludes my part in antiprotozoal drugs. So once again, I'm Pia Nicole Rockles. Thank you.
Good day. My name is Aubrey Velasco and I'll be presenting antihelminths and the 5 subtypes of Anthelmintic drug study. So, Anthelmintic is the term used to describe a drug to treat infections of animals with parasitic worms. This includes flatworms, examples the flukes, trematodes, and tapeworms or cestodes, and as well as roundworms or nematodes. The parasites are of huge importance of human tropical medicine and for veterinary medicine. So helminths cause issues in certain regions. Anthelmintics disrupt parasites across life stages, crucially through metabolic or neuromuscular action. So diagnosis guides our treatment for our patients. So next. So starting from the first subtype of antihelmintic, so that's the piperazines. And under this subtype is a drug called dithylcarbamazine citrate or the DEC. It is an anthelmintic used primarily as the citrate in treating filariasis, particularly infestation with the Wuchereria bancrofti or Loa. So the dosage, the brand name for this is the Heterazan, and then for the dosage, so the child under 10 years old will receive a 0.5 milligrams per kilogram on day 1. Then it will increase the dose gradually hanggang 3 days to up to 1 milligram per gram 3 times daily. So for over 10 years old naman for na child and adult, so we usually give 1 milligram per kilogram on day 1 and then increase the dose over 3 days to 2 milligram per kilogram 3 times daily. So that will be the frequency as well. So the route is oral, so per RM, and then frequency 3 times daily. And then for the classification mechanism of action, so for therapeutic action, it is an antifilarial. So ibig sabihin nito is usually it destroys filarial worms and it inhibits its growth some patients. And for pharmacokinetics, so diethylcarbamycin is well absorbed following an oral administration with peak plasma concentrations reached with 1 to 2 hours. So the elimination half-life ranges from 10 to 12 hours if the urine is alkalinized, so pH above 7 and up. So a renal excretion of uncharged drug is prevented and the half-life of the drug increases. So pharmacodynamics, diethylcarbamazine is an anthelmintic that does not resemble other antiparasitic compounds. It is a synthetic organic compound which is highly specific for several parasites and does not contain any any toxic metallic elements. So next is the mechanism of action. So proposed mechanism of action include platelet mediated triggering of the release of excretory antigen from microfilaria or the worms that we can see on our naked eye. So with killing involving free radicals, drug-induced alteration of prostaglandin metabolism in microfilaria and host endothelial cells, leading to immobilization of microfilaria on endothelial surfaces and adherence and killing by host platelets and granulocytes and inhibition of microtubule polymerization. Okay, so for the indication, so this is used, like I've said, for filarial diseases, including tropical pulmonary eosinophilia, leiosis, and lymphatic filariasis caused by infection with Wucheria bancrofti, Bruguiera malayi, and Bruguiera timori. So this is usually diseases we can get from mosquito bites. So for the contraindications of the diethylcarbamazine, so do not administer with patients with archocariasis or heavy loa or microfilariae to infants, elderly patients, and patients with heart or renal or kidney diseases. So do not give the drug to people with acute attacks with risk of reaction. So administer it with caution in patients with history of seizures. Reduce dosage in patients with renal impairment, so for kidneys, if they have any issues with the kidneys. So for pregnant women, so you can give pregnant women after they deliver the child, and for breastfeeding, we do not recommend it. And then next is the adverse effects for the central nervous system. Gives headaches, dizziness, drowsiness, malaise, or the feeling of restlessness of the body, weakness, joint pains for the GI for vomiting, nausea, and mild albuminuria. And then derm, skin rash, allergic phenomenon, so facial edema, yung pag-swell ng ating mga faces, and pruritus, subcutaneous nodules, and urticaria. So for respirator, bronchospasm, so it having problems narrowing of the airways, cardiovascular system, falling of the blood pressure, and leukocytosis, increased number of white blood cells due to infections. Next is as we become future nurses or nurses, so we have responsibility. So before administering this, ask patients if they have any unusual allergic reactions. So always ask patients if they have any allergies in foods, dyes, preservatives, and animal products. So certain medicines should not be used at or around the time of eating food or eating certain types of food, since there will be interactions that may occur using alcohol or tobacco with certain medicines may also cause interactions to occur. So we must limit alcohol and tobacco to our patients. And next is during the administration. So to help clear up the infection completely, so we keep the medicine for the full time of the treatment. So walang bawas, walang kulang, dapat full ang ating treatment for the medicine. So even if the symptoms begin to clear up after a few days, some patients, a second course of this medicine may be required to clear the infection completely. So sometimes there will be a relapse on the medication, so we need to talk it to our doctor. So the dose of the medicine will be different from different patients. So like I've said a while ago, dosage for the child and adult different siya. So different ang ating it may differ from patients to patients. So the amount of medicine that a patient takes depend on the strength of the medicine. That I've said the dosage and the forms. So also the number of doses taken each day, the time allowed between doses, and the length of the time to take the medicine depend on the medical problem for which the patient are using the medicine. So like I've said, different dosage for example, different doses for each infections or diseases. So after patient family teaching, very important, health education for our patients. So if the symptoms do not improve within few days, or if it will become worse, check with a doctor. And then it is important that in the doctor check the progress at regular visits. So this is to help make sure that the infection is cleared up completely. Okay, so next for the second type of antihelmintic, so this is the benzimidazole. So under this subtype is a drug called albendazole. So it is used to treat infections caused by worms. So it works by keeping the worm from absorbing sugar or glucose to our body, so that the worm can lose energy and it will die. So this medicine is available only with doctor's prescription. So the brand names of albendazole comes with Albenza, Adazole, Benzol, and Hymex. So the dosage is 400 milligrams per RM, depending on the disease and infection. The route is oral, and then frequency is usually 8 to 3 days, depending on the disease or infection. So pharmacodynamics. So albendazole is a broad spectrum Anthelmintic. So the principal mode of action for albendazole is by its inhibitory effect on tubulin polymerization, which results in the loss of cytoplasmic microtubules. So therapeutic effects. So the drug is ultimately decreases the ATP or the adenosine triphosphate production in the helminths, resulting in energy depletion, which kills the worm. So it will decrease the energy for the worms. It's like pharmacokinetics, so for the absorption, so usually it is poorly absorbed in our GI tract, so it will be enhanced with the fatty meal. So peak is 2 to 5 hours, and distribution is 70% bound to plasma protein, widely distributed throughout body, including cis fluid and CSF secreted into animal breast milk. So metabolism, metabolized in liver to active metabolite albendazole sulfide. And then elimination excreted in bile. And then half-life is 8 to 12 hours. So mechanism of action of albendazole causes degenerative alterations in the tegumented and intestinal cells of the worm by diminishing its energy production. So basically, as I've said earlier, it removes energy for the worms so that it will die and will not drive off the patient's body. Next is in the indications. So for the treatment of the perinechial chimal neurocytosis due to active lesions caused by larval forms of the pork tapeworm or Dithanium solium, and for the treatment of cystic hydatid disease of the liver, lung, and peritoneum caused by the larval form of the dog tapeworm, Echinococcus granulosus. So usually it's for worms, like I've said. And contraindication, so do not administer it on with children under 6 months. Do not administer it with patient with ocular cytocrosis. So it may cause gastrointestinal disturbances such as headache, dizziness later on, and then pregnancy avoid for the first trimester. So, and breastfeeding also bawalin siya. And then for adverse effects, body as a whole, so hypersensitivity reaction. So everything will be painful, or like and you will have trouble doing your actions, your daily activities. And for central nervous system, headaches, dizziness, vertigo, increase in intracranial pressure, meningeal signs, so alopecia, reversible, and fever. For GI, abnormal liver function test, abdominal pain, nausea, vomiting, and hematologic. So this is rare. So reversible leukopenia, granulopenia, and then pancytopenia and agranulocytosis. So skin rash and urticaria or the hives. For nursing responsibility, for before administering albendazole, so give meals absorption is significantly increased with the fatty meal. Like I've said, fatty meals do not exceed the maximum total daily dose of 800 milligrams, and then store it at 20 degrees to 25 degrees Celsius. So during assessment and drug effects, so lab tests, monitor the white blood cells count, absolute neutrophil count, and liver function tests at the start of each 28-day cycle, and QT week, quarter week 2 during cycle, and then withhold drug and notify physician if white blood cells count falls below normal or liver enzymes are elevated. And then note if patients should be concurrently treated with appropriate steroid and anticonvulsant therapy, so it will avoid any seizures. And for the patient and family education, take with meals. So see administration, like fatty meals, like I've said. Do not become pregnant during or the first month after therapy, kasi for bawal mag-take ang pregnant ng albendazole if they are their trimester. And do not take breastfeeding while taking this drug without consulting a physician. Okay, next. So proceeding to the third type of Anthelmintic, the heterocyclics. So under this subtype, it's a drug called oxymicin, and it is an Anthelmintic with schistosomicidal activity against schistosomal Manzoni, but not against other schistosomal SPP. So examinic causes worms to shift from the mesenteric veins to the liver, where the male worms are retained, and the female worms return to the mesentery, but it can no longer release eggs on the body. So brand name of it is the Vancil, and then dosage for schistosomiasis, so adult, is per orum 12 to 15 milligrams per kilogram as a single dose, and for the child, greater than 30 kilograms, 10 mg to kg times 2 doses. So route is oral and frequency is 2 to 8 hours interval. And then For the classification, so pharmacodynamics, so oxaminikin is an antihelmintic with schistosomal activity, like I've said, and then therapeutic effects. So dislodged of schistosomes begin about 2 days after a single oral dose. Movement is not complete until 6 days after treatment without the drug. After treatment, so surviving unpaired females return to mesenteric vessels. And however, oviposition egg larvae seems to stop in 24 to 48 hours after drug treatment, reducing egg load and removing principal cause of pathology associated with schistosomal infection. Pharmacokinetics, absorption, readily absorbed from the GI tract. So, madali lang siya ma-absorb sa ating stomach. Peak is 1 to 3 hours. Metabolism, extensively metabolized in GI mucosa. Elimination excreted in urine. So, half-life is 1 to 2.5 hours. If needed for tests. So mechanism of action. So oxaminikin may associate with an irreversible inhibition of the nucleic acid metabolism of the parasites. So a hypothesis has been put forth of the drug is activated by a single step in which a cysteamine sulfurase enzyme converts oxaminikin into an ester. And then these esters spontaneously dissociates the resulting electrophilic reactant that is capable of alkylation of histone DNA. Okay, for an indication for treatment of schistomiasis caused by Schistomiasis mansoni, and then contraindications. So safe use during pregnancy. So it is safe during pregnancy. So lactation or in children is not established. So it's not still established. So you need to consult your doctor. Caution use for patients with a history of convulsant disorders. And then for the adverse effects, central nervous system, transitory dizziness, drowsiness, headache, persistent fever in patients being treated in Egypt. EEG abnormalities, convulsions, which will be rare. GI, anorexia, nausea, vomiting, abdominal pain, elevated liver enzyme, and enzyme concentration. So hematologic, increased erythrocyte or the red blood cells, sedimentation rate, reticulocyte count, and increase or decreased white blood cell count. And that's it. And then for the adverse, so skin for urticarias or hives, and then for the urogenital, a red-orange color of urine. And then for the nursing responsibility, so before administering, give on an empty stomach if possible. It's best to not give it to patients without first thing in the morning. Huwag natin papakainin. So administer it with food if necessary to if it is necessary to administer it with food to reduce GI distress and improve tolerance. Store product in tightly closed container at controlled room temperature less than 30 degrees Celsius. So during assessment and drug effects, so supervised ambulation or help natin sila mag-walk or gumalaw, and use other safety precautions because less than 30% of patients experience dizziness or drowsiness. So minsan nahihilo yung ating patients, kailangan natin silang tutulungan na tumayo, lumakad, at gumalaw. Thus, if patients has a history of seizures, the possibility of seizure is increased because of the drug actions occurs within hours of administration. So if they are violently shaking, we need to take note of it and be careful so that they will not cause harm on them. So after patient family teaching, so use caution while driving or performing other tasks requiring alertness because drug can cause dizziness or drowsiness. Kaya kailangan natin i-monitor ating mga patients kasi it can cause dizziness or drowsiness. And then beware that drug may change the normal urine color to a harmless orange red. So kanina orange red, so harmless naman siya. Diba yellow naman yung normal, but pag makikita natin yung orange red, indicate na para lang siyang effect sa eliminate lang yung drug through urine. And then do not breastfeed while taking this drug without consulting the physician. Next. And proceeding to the fourth type of Anthelmintic, so the natural product. So under this subtype is a very familiar drug called ivermectin during the COVID-19 pandemic. So it is used to treat people with intestinal strongyloidiasis and onchocerciasis. So two conditions caused by parasitic worms. So in addition, some subtopical forms of ivermectin, topical or yung nilalagay sa skin, are approved to treat external parasites like heavy lice and for skin conditions such as rosacea. So during the pandemic, so this was usually during the pandemic, this was highly not recommended to treat the COVID-19 virus because it lacks evidence and was not FDA approved to treat the virus, but it is approved for parasites only. So brand names for ivermectin would be the Sklice, Sulantra, and the Stromectin. So dosage for this is 150 to 200 mcg to kg. Single dose per RM for most indications, up to 400 mcg to kg per RM for Bancroft's filariasis. So for the topical application, so 4 ounces. So route is oral and topical, and then frequency the treatment may be repeated every 3 to 12 months. So therapeutic effects: hyperpolarization of the nerve and muscle cells of the parasites results in its paralysis and death. And pharmacokinetics, a peak nito is 4 hours. Distribution is through breast milk, so metabolism, metabolized in the liver, elimination excreted in feces over 12 days, and then half-life is 16 hours. So for pharmacodynamics, so ivermectin is a semi-synthetic anthelmintic agent. It is an ivermectin, a group of pentacyclic 16-member lactose. So it's derived from soil bacterium Streptomyces avermitilis. So ivermectins are potent and broad spectrum. It is anti-parasitic agent. So mechanism of action. So ivermectins include ivermectin are broad spectrum. They bind selectively with high affinity to glutamate coated chloride ion channels presented in invertebrate nerve and muscle cells. So this binding leads to an increase in the permeability of the cell membrane to chloride ions with hyperpolarization of the nerve or muscle cell, resulting in paralysis and death of the parasite. So due this na napapatay yung parasite sa body. So for indications sa oral, so it is indicated as spread spectrum antiparasitic for the treatment of intestinal strongyloidiasis caused by strong glioids and stercoralis and onchocerciasis caused by onchocerciasis. So systemic ivermectin therapy is used intentionally for the treatment of various tropical diseases, including filariasis, cutaneous larva migrans, and loa infection, amongst others. So for the topical, you need to lagay sa skin. Ivermectin cream is indicated for the treatment of inflammatory lesions associated in rosacea. So, an over-the-counter ivermectin lotion is commercially available and indicated for topical treatment of the head lice, infestations in patients less than greater than equal to 6 months of age. So contraindications, so contraindicated in patients who are hypertensive to any component of this product, children less than 5 years of age, several concurrent illness and pregnancy, use with caution in individuals with central nervous disorders such as epilepsy, meningitis, or trypanosomiasis, and for nursing mothers. Okay, for the adverse effects of the ivermectin, so body as a whole, so patients can get fever, peripheral edema, and for the central nervous system, dizziness, and for the cardiovascular system, with the tachycardia or increased heart rate, and then for the GI, diarrhea and nausea, and skin pruritus, rash, and others would be the arthralgia and synovitis and lymphadenopathy. And for the nursing responsibility as future nurses, before administering, give tablets with water rather than any other type of liquid. So let's refrain from using juices or sodas or any liquids with sweeteners or artificial sweeteners. So always give water, and then store below 30 degrees Celsius. So during assessment, drug effects, monitor for therapeutic effectiveness indicated by negative stool samples, monitor for cardiovascular effects such as orthostatic hypotension and tachycardia, then monitor for and report inflammatory conditions of the eyes. And then after patient teaching, so get a follow-up stool examination to determine the effectiveness of the treatment. So treatment for worms does not kill adult parasites. So we need to have a repeated follow-up and retreatment for the physicians. So it is usually needed, and notify physician if eye discomfort develops, and also do not breastfeed while taking this drug without consulting the physician. Okay, for the next last subtype.
Okay, for the last type of the anthelmintics. So neclocide is the brand name for the generic name medication neclosamide. So it belongs to the subclass of drugs known as anthelmintics, specifically salicylate derivative, and anthelmintics are a medication used to treat a parasitic worm infection. So the dosage of neclocide can vary depending on the specific infection being treated. And for the typical dosage range for adult is 2 grams to 1 gram. So depending on the type and the severity of the infection. For the children is 500 mg to 250 mg. So again, depending on type and the severity of the infection. So route of the administration, neclocide is taken orally. So which means it is administered by mouth. And the typical dosing regimen for the neclosamide is a single oral dose. And in some cases, if necessary, the treatment may be repeated after 7 days. So it is important to follow the specific dosing instruction provided by the healthcare professional or the indicated in the medication label. So it is also crucial to complete the full course of the treatment as a prescribed even if the symptoms improve to ensure the effective eradication of the parasitic infection. So as with any medication, so it is recommended to consult a healthcare professional for proper dosing instruction and to discuss any specific consideration or precautions related to the use of neclocide. Okay, so for the classification and a mechanism of action. So the classification, niclosamide is classified as an anthelmintic drugs. So anthelmintics are the class of medication used to treat the parasitic worm infection, specifically the helminth infection. And niclosamide is primarily used to treat the tapeworm infection in a human. So it works by inhibiting the mitochondrial oxidative phosphorylations process in the tapeworm, leading its death. And the mechanism of actions may alter the anaerobic energy production in tapeworm by inhibiting the oxidative phosphorylations in their mitochondria, which decrease the synthesis of ATP, and niclosamide goes the scolex or the head-like segment and the proximal segment of the tapeworm through detach from the intestinal wall, and which leads to parasite evacuation from intestine through the normal peristalsis. Now for the indication, niclosamide is anthelmintic indicated in the treatment of the beef, pork, fish, and dwarf tapeworm infection in the adult and the children. So, niclosamide is an anthelmintic used for the treatment of tapeworm infection by Drug Bank 2010. So the anthelmintic are drugs that are specifically um designed to combat parasitic worm infection. In this case, niclosamides in targets a tapeworm infection caused by different species. And tapeworm infection can occur from the consuming the undercooked or contaminated meat or fish that contains tapeworm larvae. So for the contraindication, are specific a situation or condition which medication should not be used. So age under 2 years, or niclosamide is contraindicated in children under 2 years of age. So the safety and effectiveness of the niclosamide have not been established in this age group, and its use is not recommended. So the hypersensitivity to niclosamide, other anthelmintics or their components. If an individual has a known hypersensitivity or allergy to niclosamide, other anthelmintic medication, or any of the components of the niclosamide formulations, it is contraindicated to use the niclosamide. So sensitivity reaction can range from the mild skin rashes to severe allergic reaction and anaphylaxis. So it is essential for the healthcare professional to consider this contraindication before prescribing the niclosamide, and to review the individual's medication history and potential risk. So if there's no known contraindications or the suspected hypersensitivity, alternative treatment options should be explored. Now for the adverse effect, are unwanted or a potentially harmful effect that can occur when the using a medication. So you have here the central nervous system. The niclosamide can affect the central nervous system and may cause the following adverse effect, which are the dizziness, a feeling like lightheadedness or the unsteadiness, or the and also the drowsiness, a state of excessive sleepiness or feeling tired, headache, pain or discomfort in the head, lightheadedness, sensation of feeling faint or dizzy. Now for the eye, ears, nose, throat, niclosamide may cause the following adverse effects. So the taste perversion, so it is a change in the sense of taste and resulting in an altered perceptions of flavors. And the gastrointestinal, so adverse effects are the relative common with the niclosamide use, and may include the abdominal distress, so this is general discomfort or a pain in the abdominal area, the nausea or loss of appetite or decreased desire to eat, the constipation or difficulty passing stools or infrequent bowel movement, the diarrhea of loose or water stools, and nausea, feeling or discomfort or queasiness in the stomach, and often followed by an urge to vomit. And vomiting, the forceful expulsion of stomach contents through the mouth and skin to niclosamide may rarely cause the following adverse effect: the anal pruritus and itching around the anus, and rash, an outbreak of red, raised, or swollen skin, often accompanied by itching. And so it is important to note not all individuals will experience this adverse effect, and some may experience no side effect at all. So if any adverse effects are bothersome, so persistent or worsening, it is recommended to consult a healthcare professional for further evaluation and guidance. Now for the nursing responsibility. So before administration, so we need to ensure that the prescription for the niclosamide is accurate, complete, and properly documented, and conducted through the assessment of the patient's medical history, including the allergies, current medication, and any contraindication or precaution related to niclosamide use, and provide information to the patient about niclosamide, including the purpose, expected outcome, potential side effect, and any specific instructions or precautions. And for the drug during the administration rather, is to confirm the medication order and check the medication label against the prescription to ensure the accuracy, and also follow the proper procedure to prepare the correct dosage of the niclosamide, adhering to sterile technique if necessary, and also administering the niclosamide according to the prescribed dosage, route, and usual oral, and the timing, and ensure the patients and understand how to take the medication correctly. And also observe the patient during the after medication administration for any adverse reaction or side effects, and monitor the vital signs and document any changes. And for the after the administration, adjust any discomfort or side effect experienced by the patient after niclosamide administration, offers appropriate intervention such as providing water or the administrating the antibiotic medication for the gastrointestinal symptoms if needed, and accurately record the administration of niclosamide, including the dosage, route, and date, time, and any observed side effect or adverse reaction, and reinforce the patient's education regarding the potential side effect or the adverse reaction to watch for, and provide instruction for follow-up care or monitoring as needed, and communicate any relevant information about the patient response to a niclosamide to the healthcare team, and collaborate on any necessary follow-up or further treatment plans. And for the patient or family teaching, we're going to instruct the patient to take a niclosamide after light meal. For young child, instruct a parent to crush the tablets to fine powder and mix with a small amount of water to make a paste, and urge the patient to complete the entire course of niclosamide therapy, and advise the patient to avoid the hazardous activities until the drug CNS or effective are known, and advise the patient to store the niclosamide in cool, dry, dark place, and cautions against storing the bathroom, near kitchen sink, or in other damp places because heat and moisture break the down drug, and inform the patient that stool may need to be examined on day 7 or treatment, and again 1 and 3 months after treatment. And also instruct the patient to wash hands thoroughly, to wash all the bedding, and to use the meticulous personal environmental hygiene to decrease the risk of the auto-infection. So importantly, should wash the hands every day to prevent microorganism, and also for the cautions of patients against eating undercooked fish, pork, or beef. So that's all.
Okay, so as you can see here, we have the flow chart of our report. So about the antimicrobial therapy. So for the antibiotics, it is really a crucial class of antimicrobial agents widely used to combat bacterial infections. So they exhibit a diverse range of mechanisms to inhibit the growth or kill bacteria. So this report delves into the classification of antibiotics, highlighting case subtypes and providing representative examples within each subtype. Next is the antifungal. So this agent plays a vital role in combating fungal infections, which can range from superficial skin condition to severe systematic illnesses. This report aims to categorize antifungal agents into distinct classes and provide representative examples within each class or to better understand their mechanisms and applications. For the third one is the antiprotozoal. This agent plays a vital role in combating infections caused by protozoa, which are single-celled organisms responsible for various diseases. This report focuses on categorizing antiprotozoal agents into specific groups and representing notable examples within each category, shedding light onto their mechanisms and applications. And for the last one, the Anthelmintic, these agents are vital in the fight against parasitic worm infections, also known as helminthiasis. This report seeks to categorize anthelmintic agents into specific groups and provide notable examples within each category. Understanding these classifications is crucial for effectively combating helminthic infections and devising appropriate treatment strategies. Next slide. Okay, so that concludes our report. So to sum up everything we reported, delving into the fundamentals of antimicrobial therapy provides valuable insights into the world of antibiotics, antifungals, antiprotozoals, and anthelmintic drugs. This knowledge equips us to make informed decisions when treating infections, considering mechanisms, classifications, and indications. Thank you so much for listening and for the opportunity to explore these essential aspects of medical care. If you have more questions and clarifications, feel free to ask.